let me know when we're live, Dan.
Okay. Okay, everybody, we are live.
Okay, great. Let's start the meeting. I'd like to call this meeting to order. It's the Board of Education special meeting to discuss fall reopening plans. We had a very productive meeting last night, really, to focus on the lower schools. This evening's agenda really will start off with a public health guidance and discussion. We have Mark Cooper joining us from the Weston Westport Health District, as well as Dr. Laura Marks, who's our medical advisor. I'm not sure if Dr. Marks is on yet or not, but we'll be hearing from them. We've been really working very closely with both Mark Cooper as well as Dr. Marks in terms of providing that medical guidance that we so need in order to really gel our reopening plans. Then we'll be discussing recommendations for the reopening scenarios. Bill will give, I think, a brief review, I guess, of what was also presented last night. We have a state and regional update for the fall 2020 reopening, and then we'll focus most of the meeting on reopening plans for the upper schools, which will be led by Lisa and Dan. Later in the agenda, we'll have Mark Berkowitz talk about athletics and discuss reopening plans as it relates to athletics. And then we'll probably regroup as a board and discuss what we're going to do with respect to next steps in terms of discussing reopening plans, as well as discussing the form of the public forum that we are going to hold next week. Before we get started with the public health guidance and discussion, I'd like to open the meeting with a bit of an upbeat message. I think we really didn't hit on this last night, but you know, we're very fortunate to be living in Weston during this public health crisis. We have an incredible educational system, dedicated teachers and administrations who really dedicated their lives to educating our kids and keeping them safe and healthy. There isn't another group of people that are going to be teaching our kids during this reopening. It's that same group that is actually have dedicated their life to making Weston what it is today. And so while we have a huge amount of questions around the reopening plans, while we still have issues that still need to be determined as we get closer to that date, the one thing that I think everyone should keep in mind is that fundamentally, we have a group of dedicated professionals that we've actually ensured the educational needs and the health and safety of them every single day during normal times. And this is the very group that's going to basically take our students through this journey from where we are today to getting back to normal. So I hope that parents that are listening, really, even though you have a lot of questions, please take comfort in the fact that we have an incredible group of people that are behind the scenes who are basically working twice as hard to make sure that all the needs of our students, both educational needs as well as health and safety needs, are being met during these challenging times. And with that, maybe Bill, do you want to start the discussion on public health and medicals?
Sure. Thank you, Tony. Can you all hear me? Thanks. If you're worried about the backdrop in this era, if people in your family are ill, you get home to help them out. And it's a recoverable illness, but these things happen. So I'm actually in my garage. If that's not a Zoom backdrop that you can find, if you like it, send me an email and we'll take a photo and maybe Zoom will put it up for you. We had, I think, a very productive meeting last night. The leadership team is meeting every day now, just for quick base touching on things. The group felt very pleased with the conversation, the discussion last night. I also want to note that we are receiving hundreds upon hundreds of emails. Literally, that's the number. and I totally endorse and support all those questions coming in. Earlier today, I did send out to all staff and to all families a system we're implementing immediately so that we can best handle all of those questions. Most of them started arriving late Tuesday, and we really would ask people to use the system that we've sent out, because that is the way for us truly to address all of your questions. I do appreciate the board's and Tony's compliments of the team. The team that will respond to you is the same team that is designing what we will do. So I, over the last several days, had to focus on, is the recommendation document solid? Working with the leadership team, working through personnel issues, working through updates from the state that flow even up until right before this meeting, piecing all of that together. We're in very tight and close coordination with fellow superintendents and other administrators in the region to actually try and grapple with many of the questions that parents are asking us. And as a parent in another district, I can assure you that the kinds of questions you're asking are getting asked in this district as well. So the system we've implemented, I hope you all will endorse and use. Many of the questions are almost identical. So that guides us to an FAQ, a frequently asked question approach. So we can answer those questions. We'll start having answers up on the dedicated COVID-19 resources webpage. Starting tomorrow, there are already answers up there to a number of the questions, and we will keep putting them up there just to provide clarity. The principals who know many of you as families very, very well, they may still respond a wee bit individually, but I've asked them to focus on planning, focus on actually creating what will be the answers for your children when they're in school. So again, I appreciate the questions. We will get you answers. It's just a little slower than immediate because again, the same people designing how we're going to reopen in a brand new way, never tried, are the same ones who'd be answering your questions. So we will get to those. In terms of Mark Cooper and Dr. Laura Marks, who's on the line, they've been very, very close to us all through this process. I'm pleased now they'll come into a public setting to talk with the board about their critical guidance on what, if you look in the document that we put forward for the recommendation, we set 3 criteria, 3 top priorities for us as set educators for your children. First is the health and well-being of your children. Second is bolstering the academic growth and development of your children. And third is advancing the social emotional learning for your children. In a pandemic such as this, health has to be first. We're in this situation of schooling because of public health, because of medical concerns. So that has to be our first concern, our first attention. And Mark Cooper's been a great partner already, as I mentioned, Dr. Marks, and indeed, it's in the text. The last major section of the recommendation document that was submitted to the board last night has been sent out to all families, all staff. That last major section takes guidance from the state as to 3 scenarios, really the 3 scenarios we might have of COVID-19 exposure. And if we had any one of those scenarios in Weston, how would we proceed? We took the state guidance and then we wove that in with the guidance from Mark Cooper and the critique of Dr. Laura Marks. So indeed, that last portion is substantially shaped by that expert pairing, public health and medical, with Mark Cooper and Dr. Laura Marks. As families and staff read that section, you will see that any one case of COVID-19 that we have or we think we have, the process brings us immediately right to Mark Cooper, right to Dr. Laura Marks to talk about how we proceed. That document, I shared it as a draft, not yet final, because I want the community to know what we're working on and to be, full transparency on such a fundamental issue. So let me now let the board engage with questions and discussion with Mark Cooper and Dr. Laura Marks so that you can get, help, guidance on any number of the issues that you as a board, really on behalf of families and students and staff, any of those issues you're concerned about.
I can actually start. I'll go back to that very first discussion that I had with Mark and Dr. Marks, which is I'm hearing that, and this is no longer the case, but at the time, I'm hearing that some other districts were thinking about getting their K through 5 in full time. And I wanted to basically start at the beginning saying, okay, how should we be thinking about this? How should we be thinking about the social distancing, masking, in order to see whether it's possible to actually have a full open in the fall? And I think maybe we start from there, because I think there's still a lot of questions about, well, why can't we all go back to school? Connecticut is looking good. Let's, let's give it a try. Let's experiment. And so that was my first conversation. And I think it's good for the board and maybe the parents to really hear some of the advice, some of the medical advice that really drove our thinking around moving right away to a hybrid model. I don't know, Dr. Marks or Mark, whether who wants to take this one.
I can certainly start. Good evening, everyone. Initially, everybody's responding to the governor's directives, and that's really what's driving the issues. Not only school openings, but restaurant openings and personal services. All those things are coming down from governor directives. And initially, he was very set at saying we're going to have full openings of all the schools. And in watching what's going on around the country with some of the school openings, I think it's raising concerns in the governor's and his team that looks at these issues keeps revising what their expectations are and what Board of Educations need to do, what restaurants need to do, all that sort of thing. So it's kind of a fluid situation. Connecticut is in very good shape. Weston is in excellent shape in terms of our transmissivity of the virus. So you're getting roughly one case, I think it's a month. That can certainly change. We hope that it doesn't. So you're good in that perspective. But we're all around us. There are towns around us here, Westport, Weston, where they are having outbreaks. And they're having outbreaks where people are getting together and are not socially distancing or not wearing masks, sort of thing. So we know that there's kind of a relationship between being non-compliant, if you will, with the public health guidelines and the increase in COVID cases. So we're learning as we go. This is, I'm sure you've all heard it before, it's novel virus, meaning we really don't know much about it. It's a learning curve as we go. So we are in fact watching what's going on all around us. We're trying to take that information as it comes to us and apply it locally so that, again, safety is, as Bill said, safety is very important. It's one of the first things we want to make sure the kids and the staff are all safe in going back to school. Let me stop there just to see if Dr. Marks wants to jump in.
I absolutely agree, Mark, with everything you said. I think that we had a bunch of really wonderful talks at the beginning, and what is interesting to us, and I think the doctors have had some time to get used to it, but maybe the public has not. We don't know, and we're not used to not knowing things about science and about medicine in this day and age. So we have to, everything has to catch up to. The science has to catch up to what we want it to before we can really have definitive answers for everybody on the spot. And I think that the interesting thing is that now what we have to do is be flexible. We have to make a plan and be willing to pivot and change the plan as things change. So we discussed that we really could not have a full student load of kids in the school every day because we couldn't have social distancing. And we don't want to have, as Mark said, kids go back to school, everything's going well in Weston, and then all of a sudden somebody transmits, there's too many kids in the class, everybody gets it, and it becomes a hot spot and it becomes a source of infection. We're trying to avoid that and have everybody go back and be healthy and safe.
Yeah. One of the things that we talked about was some of the, some of the recent medical, when you were speaking to some of the your fellow advisors around in the districts, there was basically some early indications that led others to believe that we actually that younger children could go back in. They were they were less prone to the virus. They were less prone to spreading it. but we had a discussion, you alluded to some more recent.
So, right, so there was a study that said that children from 0 to 10 were less likely to transmit the virus than children from 10 to 20 or 10 to 19. And I said, it wasn't a controlled study. They were just sort of looking at the kids and who ended up being ill. So Mark and I discussed that. So very soon after that, a few things happened. First of all, there was a camp in Georgia where there was a lot of outdoor activities, which you'd think would be safer. And a lot of the kids infected each other. There were a few, they went in and there was not a lot of infections. And then there were a lot. And I think actually somebody said that I think in the last month, there's been like 100,000 children who have been infected in the US. So clearly now that's even sort of old data. But then there was another study that the viral load carried in children's noses are as high or higher as adults. So there's a lot of questions why are children not transmitting the virus or weren't transmitting the virus as much as adults? Maybe because they didn't have the opportunity and they were sort of under the watchful eye of their parents and they didn't have the ability to go out, number one. And number two, it could be possibly lung capacity where they couldn't sort of project as far as an adult in terms of their breath and their cough and their their speech. So the aerosol droplets couldn't go as far. So maybe that was why. And it's going to be very different if we have all the kids in the room all day long, 2 to 3 feet away from each other. That all bets are off in terms of that. Then I think that they will transmit the virus. It seems to, the data seems to say that there's certainly much more risk than we thought that there was.
And what I can add to that is what we've been seeing in the public health side is that the positive cases that are coming before us, contact tracing, are all in the younger age groups. And that's really not the preschool ages, but say 17 to low 20s are the majority, if not most of all the cases we have been seeing in the last, say, month or so.
Would you, one of the things that we've been discussing has been Connecticut is good. Like, we know what to do if things get worse, right? But because Connecticut is in good shape and Weston is in good shape, how do you then, what's some of the things we should be thinking about as we proceed in the fall if things do stay low risk as indicated by the metrics? How should we be looking at easing? Like, what kinds of things can we put in place so that we can actually have touch points to say, okay, at this point we can actually ease a little bit more. At this point we can probably go in full. Like, what are some of the things that we could put in place, and how should we be thinking about it? Because we're not going to be going from bad to good. We're going to be going from good to even better, right? Potentially.
Well, we certainly hope that.
We hope that, right?
We certainly hope that. We watch the metrics every day, but we still know that there's COVID-19 in the community. When we could be assured that COVID-19 is no longer in the community, therefore no more community spread, I think then that obviously would be a point where you could start thinking about going back to a closer to an old normal. But we also know that there's an influx of people coming from other states where there is higher COVID rates. So that may in fact be reintroducing COVID into our communities. And only time is going to tell us whether this influx of peoples from other states around us with higher COVID rates is going to influence our rates or not. It takes about 2 weeks, if you will, for an exposure for it to pop up on our radar if somebody is going to be positive. So there's a big time lag going on here. There's really nothing in the immediate sense that I know of that would say you can kind of proceed along the line. I think it's going to take well into the fall, spring, maybe even a whole school year for us to be able to say, yeah, it's safe to do something else.
Mm-hmm.
I think that there's a lot of travel. You can see what happened just recently in Rhode Island, where it was, low, and then travel in, and they come, the rates going up. And there's not just travel in, but there's people that, inhabitants of this state who go out and go to vacations and then bring it back. So it's both.
What I'm also hearing on the state health department level is that COVID-19 seems to be moving up the 95 corridor. And that's somewhat of a concern. And just recently, New York is now enforcing mask wearing regulations, if you will, or guidelines. Connecticut is getting more serious about enforcing mask wearing. So there is a growing concern. And I think Dr. Fossey on the national level keeps saying it's going to be the worst public health fall we've ever seen. I hope he's wrong. But again, time is going to tell us what that picture really is going to look like.
You know what the thinking was, or in our neighboring districts around Bridgeport and Norwalk, because they seem to be going back full at the lower grades. Any insights into that at all?
I really don't. I've been working with Weston, Westport, and Easton school districts a bit. No, I have no insight into those. I've been busy enough with storms and what we're doing here to worry about Bridgeport.
Yeah, I actually spoke to the advisors of those areas, those towns, and you know, they basically said nobody has the data. There was a little data early on, as I suggested, to say that the younger kids were not transmitting the virus as much, and they said that there's no data, so this will be sort of the experiment. That was sort of they thought let's do it and see what happens. That was, you know, sort of the thought, which, you know, maybe that's as valid as anything. Maybe I'm just more conservative in my thought. Everybody's got their own way of approaching it. And the truth is, you can pivot on a dime. If you go in and you see that there's, you know, too many, there's transmission, then you can certainly change the model.
Mm-hmm.
Yeah, Tony, I think when we get through with Mark and Laura later, I mean, tomorrow again, I have the insights from those direct superintendents as to where they are, what the thinking is, but we can always bring that perspective. But it's excellent to get any insights that Laura and Mark might have on that question, because they are in the very much the minority at this point. The vast majority are opening up hybrid.
Mm-hmm. Have you, when we talk about protocols, what are your views as the most, the things that we should actually, our top priorities with respect to health and safety protocols?
Well, the social distancing, if you can't keep 6 feet apart, then wearing a mask. Those two things seem to be very effective as looked at on a national level. The question about masks is being looked at a little more carefully. They're now doing some studies on the efficiency of masks, if you will. So I think more information is coming out in terms of what kind of masks are more effective, work better to preventing the spread. But masking, if you can't stay 6 feet apart, masking, those two sort of things has been shown to be very effective in preventing transmission.
Mr. Cooper, you spoke about the efficiency of masks, and that's one thing that I've been reading about recently.
Gina, we can't hear you. We can't hear you.
Gina, you're frozen.
Yeah, you're frozen.
Sorry.
Okay, we can hear you again.
Yeah, you can hear me now? Hi.
Yeah.
With the new studies coming about the possible inefficiency of certain types of masks, should we make a request or be specific about the type of mask our students should wear?
Well, I think that makes some sense. One of the things I've recently read or heard about is that for testing the efficiency of masks, if you can blow a candle out through a mask, it is not thick enough, whatever, it does not filter enough out to be effective. A simple test. But yes, I think there needs to be some standards. And when I deal with restaurants and restaurant workers, that question has come up a lot because people are wearing these bandanas and other things. And some are very sheer, almost like a sheer soap sort of thing that offers no protection at all. And we've had to say that those are not acceptable. So yes, I think there are acceptable masks and there are unacceptable masks, and there needs to be some standard that the school should kind of insist on. Yes.
The other thing that's coming up recently is there are masks with vents in them. Usually I think that the construction, it was meant for construction purposes, but those are not effective to prevent COVID either.
Mark, you mentioned that if social distancing of 6 feet cannot be maintained, then masks should be worn. So I'm thinking of our Hurlbut friends, the little ones, the kindergartners, first graders, and second graders. And if their desks are 6 feet apart and they need a mask break, what are your thoughts on that? If they're already sitting 6 feet apart?
If they're sitting 6 feet apart, I would say they don't need to wear a mask. But when they get out of that seat and start to get closer together, that would be the time to put the mask on. So if you're 6 foot apart in public, you are not required to be wearing a mask. So I don't think you would need to be required to wear a mask when you're 6 foot apart in a chair.
I think that if it's a prolonged period of time, I think the medical community is feeling like if kids are in the room together, I think that there's still a risk there, even.
Probably true. That's why some of the guidelines, you know, the ADAPT, Advance and Achieve guidelines that came out from the state talk about increasing ventilation. So that's one other strategy that school districts need to be thinking about is, again, you are in a containment area, a school classroom. You really need to think about how do you increase airflow. If you can open up windows, that's great. If you can't have windows, because some of the new school systems don't have windows that open, engineering, from an engineering wise, somehow introduce more fresh air, increase the blow rate, so there's a more turnover of fresher air. So Dr. Marks is correct. There is that concern when you're in a contained room, an area that the virus could build up. I'd like to assume that those children are going to be healthy to be in school in the first place, so they're not positive for COVID, because if they were positive, they shouldn't be there. So yes, Dr. Marks brings up a valid point, but I think some of the engineering solutions to increase airflow would help mitigate that.
What are the thoughts around, there's some questions from the community around temperature checks every day. What are the thoughts around that in terms of, it goes to the whole area of certification, right? Each day, right? And how does temperature checks really help or not in terms of, because there is a group of questions we have, which is why don't we actually check everyone's temperature, both staff and students, every day?
I'll go first, I guess. Dr. Marks can.
Oh, here, you want me to? I'm sorry.
Sure, if you like. Go. Yep.
So I think that temperature checks have been shown to not be that helpful, because as we've heard, so many of the people are asymptomatic. So many of these kids don't get fevers. And I think that that's, that they've maybe even, I actually don't know the data between children and adults. I don't know if it's known, but I think that so many people are asymptomatic that I don't think temperature checks are that helpful. I'm hoping people, as you just said, Mark, are keeping their children home if they're sick, and certainly with a fever. But, we've been doing temperature checks at Willows, and it's very rare to find anybody, and they're coming to us, sometimes for sick things, but for sick reasons, but it's very rare to find anybody with a fever.
Absolutely agree. If you're checking temperatures when they enter the school building, it's kind of too late. Now you got to use your protocol to send them home if they're got a temperature. Let's understand that everybody needs to be a partner in this preventing COVID transmission in our communities. That includes the parents in the whole community. Parents ought to be checking their children at home before they bring them to school or put them on the bus. And if there's any sign of illness whatsoever, and don't forget, we're entering the cold and flu season, so there's going to be a lot of confusion. Do I have a common cold? Do I have the common flu? Is it COVID-19? A lot of people are going to assume I've got COVID-19 when maybe it's just a touch of a common cold. And I don't want to be closing schools for colds. Temperature checks are not appropriate in the school setting. They should be done at home every day by parents.
I agree.
Laura, Dr. Marks, when do you actually, in your practice, when do you start seeing children with respect to flu symptoms? Like what month is it usually start appearing?
I'm so glad you brought this up because this is why I couldn't be here last night, because I was at a meeting for hours and hours at my practice trying to figure out how to give the flu vaccine to and I actually wanted to ask you guys, this board at some point about some help with trying to do a flu clinic, but I'll get to that later. It's different every year. There could be a seasonality to the flu. The last 2 years, and Mark, please correct me if I'm wrong, but the last 2 years, I think they've been a little bit late. So we've seen it December to, February, March. We had, I remember very bad, January, February, the last 2 years, but I think it could come earlier. We start giving the flu vaccine usually September, but this year I think everybody is going to start giving it as soon as we get it to try to prevent some overlap of symptoms and confusion.
Mm-hmm.
And interestingly, some of the tests, sort of the rapid tests, not the PCRs, but some of the rapid tests that the offices are trying to get their hands on are going to test for both COVID and flu, and some even COVID, flu, and strep.
Mm-hmm. Do you think you'll have an adequate supply of tests to be able to handle this season?
Sadly, I don't think so.
Mm-hmm.
We're working on it. I can't even begin to tell you how much, but that is completely out of our hands.
Right.
I mean, on that, should we be requiring flu shots as part of the vaccines?
I don't think you're going to be able to have a full roster of kids, and if you do, I don't think we're going to be able to get our hands on enough.
Okay.
And that's also, supply that we have no control over.
Marks, if, in the winter, when we've had a full rash of kids being ill and they're going to their pediatricians to get the test, and pediatricians run out of tests to be able to test a kid for COVID before they can come back into the school district, do we have a fallback protocol for they've been well for a certain amount of?
Yes, I'm so sorry about that. So first of all, let me just tell you that we have done no tests yet at Willows. We have not had anything. And I think it's true of all the pediatric offices. We are not even expected to, they're talking about maybe getting us one instrument. They're talking September, October. So, this is not going to be, we haven't even done anything yet. So that's going to be a problem. It's not even, we're definitely not going to be able to test everybody who's there's a question. I think that, and Mark, again, correct me if I'm wrong, I think it's 10 days from the onset of symptoms and 24 hours with no fever, without antipyretics, no Tylenol, no Motrin. That's the CDC right now. Am I up to date on that?
Yes.
So that's the answer. I think if you start getting sick and you cannot get your hands on a test, which was what was going on, in the spring, then that was what we use. Well, we use something a little different yet, but that if we get that situation again, that's what we would do. 10 days after onset of symptoms and 24 hours with no fever, without any interventions. So this is not the time to tell kids, to make sure that parents know, don't give your kid Tylenol and hope they make it through the day without a fever.
I guess I'm a little confused on the fever question, because I heard that the temperature really, yeah, of course. I mean, there's asymptomatic cases and there are things that are going to go undiagnosed, and but you get on a plane, children's activities today. I mean, there's a lot of protocols on temperature checking, and right now we're saying that that's part of the CDC protocol as well. The way I've been thinking about it is that the logistical thing about checking kids into the school is difficult, but should we be thinking of, there's a self-certification that do spot checks in the classroom by our nursing staff? I mean, I think that may be a signal, to parents that you not only need to self-certify, but if you're part of the sample, then it may create a little bit more diligence around that. So I'm a little bit confused on this issue.
I'm not sure I understand if it's a question. Are you saying you're advocating for like spot checks in each classroom to see if children have symptoms or fevers?
Well, I heard on one hand saying, the temperature doesn't work to identify because there's asymptomatic cases, which would follow on to say that we should not have some sort of extra protocol at the school. So if it does matter, what else could we do to implement, some sort of checking at the schools for temperatures, whether it be random? It seems like it does matter.
I don't know what benefit that would be. That would be a school policy, but don't forget that anytime we have a positive case in our community being Westport, Weston, and Easton at this point, we're going to do contact tracing. So we should be aware of everybody that is positive. Through our contact tracing, we then reach out and talk to everybody who's had contact with that person. So if it happens to reach into the school system, we will be working with school officials to try to identify everybody that might be a potential contact, might be a potential future COVID patient, and work with them on a one-on-one basis so they don't spread it. So there's other safeguards outside of the school system that should help prevent COVID from even getting into the school. And obviously, I think that's all our goal. Is everything going to be 100% effective? Absolutely not. There's always going to be room for something not to work. So we're trying our best efforts. I'll leave that question to Dr. Marks and the school administrators, whether it's appropriate to go into classrooms and say, okay, you and you, we're going to test your temperature. That's a school question.
Am I understanding that you are questioning if people sort of tried to hide it in the morning? Like, is that what you're asking?
My simple question is if there's a way to, again, if the protocols are to try to minimize people with temperatures that may be showing symptoms and may be positive, as a way of identifying those people to get them back out of the classroom, whether we should be considering, other extra protocols around temperature checks. And maybe you're right, it's a question for us in the administration, but I just wanted to get the medical viewpoint on that.
I'm just confused. I think
Yeah,
that,
Victor, if I may clarify or try to, what I heard tonight from Mark and Laura is what I've heard for a while. The temperature checks are not a valid and reliable way to determine if you have a COVID-19 issue in your school. So the logistics of that is why, yes, up till now, we've had school groups, airlines, and others doing temperature checks, but this is where we're learning more. And the validity and reliability of that is actually proven to be limited. That's what I heard both Mark and Laura say tonight. So also then to take busy nurses and spread them around the building doing spot checks for something that is not valid and reliable as to identifying the situation, that's where we would not think it would be a wise deployment, as I understand it. If temperature checks were seen as valid and reliable, obviously the approach would be very different than what we're currently thinking. So, but maybe I'm not hearing Mark and Laura clearly, though I've had the advantage of lots of conversations with them.
I would agree with you.
And I think if somebody is not feeling well, then you immediately take them out of the environment.
And we have that practice. The principals maybe can speak best to that, and this is something in the 5 days of lead up prep time for teachers, per state mandate, but our own good thinking, we're going to be spending extra time on health and well-being and what to do when you sense somebody's not well. And my hunch is it may be, fever may appear, our professionals can read what's going on beyond the temperature check. So, but I appreciate clarifying, Victor, because later I want to get a little clarification on the issue of masks, which we can come back to, because the commissioner has been quite clear, mask 100% of the time. And Mark is very active with the Department of Public Health and the CSD now. That might be a point where we get some help on clarifying that. But that.
I want to touch on contact tracing a little bit. It's something that we haven't been discussing a lot. And so, Mr. Cooper, once we have identified a positive case in the school, can you please take us through a hypothetical scenario of what happens next?
Sure. I don't think you're going to verify a positive case in the school. I don't think you have the testing equipment nor the expertise to actually run the test in the school. I may be wrong. But a positive case is going to be identified by their medical home or somebody else. You've got to go get a test. A nurse may know that somebody doesn't feel well, has this symptom or that symptom. But again, COVID-19, the seasonal flu, common colds, and other illnesses have all the symptoms are overlapping. A school nurse will know that, yes, Johnny doesn't feel well, but will not be able to diagnose COVID-19. At least you may in the future get the equipment. I don't think you have it now. So you're going to rely on the medical community to do the diagnosis. Anybody who gets a test, those lab results go directly to the public health world, to the state health department and to us. As soon as we get a positive case, we have contact tracers waiting, and we've been contact tracing for our entire public health history, but obviously that's ticked up a bit in the last, since March. We're doing contact tracing now. So we talk to everybody that person identifies as somebody they may have been in contact with. We would work with school officials to try to find out if the sick student has a cohort. We evaluate all of those, all the information that's available around this particular case, how long they may have been ill, where they've been, all that sort of stuff, and then make recommendations that Johnny stays out of school. Maybe Johnny and his best friend, could be Johnny and a whole class. All those things are very fluid and has to be looked at on a case-by-case basis. It gets kind of complex. So it is the health district that does the contact tracing based on test results from the medical community that comes to the state health department in the labs directly.
Excuse me, can I ask a question or make a point? Based on that information, Mr. Cooper, would it behoove us then, I mean, I think at the lower grades they do this, but at the high school we don't do it as much, to ensure that teachers keep seating charts where the students are sitting in the classroom, so then we have that information if we need to participate in any contact tracing facilitation, if you will.
You're on mute.
All right. Keep in mind that CDC defines a close contact as somebody that has been within 6 feet for over 15 minutes. So being in the same room for 3 minutes does not make you a close contact. But to answer your question directly, yes, that sort of information is what we might look to the school. If you have it, it would be helpful. I think that's the whole idea between, the Adapt, Advance, and Achieve's recommendation that kids be kept together in cohorts so that you're reducing the possibility of somebody going through the whole school.
Sure, and at the high school, we can't keep them in cohorts. So I think that the seating charts would become all that important. Thank you.
Understood. It's not going to be easy. Yep.
Ruby, if I may, the section in the recommendation document, page 34 to 35, Mark Cooper wrote that. And that spells out in the detail that you're asking what we would do. So I think families, parents, all the rest, staff, right there in black and white is how we would approach it. And that's designed to be an excerpt that we will take out of that document and make very visible in the hands of staff and others as to how we'd approach it. But it's very clear in my mind. I would urge everyone to look at it, page 34, 35, both for how Mark laid out what they would do, but also the communication limits, which Mark, you may want to speak to that a bit. in terms of what you actually coached me on, because I had a draft that was probably a little too open from public disclosure, and you coached us back to a place that fit federal laws, both for FERPA and also health privacy issues.
Yeah, it's a complex situation. Of course, people want to know. I understand that. I've been a parent myself. But you have all kind of confidentiality laws and HIPAA and all sorts of stuff that intertwines here. So if you have a positive COVID case, the health district itself and its contact tracing will contact directly everybody involved. The way it was written before, if somebody came in with cold symptoms, you might be writing a notice to the entire school population. Not necessary. You don't do that now for the common cold. So I don't know why you'd want to do that moving forward. I think you need to be careful with what you communicate. Clearly, if it's a big problem, you've got to close a classroom, a school, a district, you're going to have to notify parents of that. If one child shows up in school with COVID-19 and through our contact tracing, we find out that maybe he was positive, he went for the weekend someplace, it was a close contact to somebody else, and there's very little exposure in the school, I don't see the need to let everybody know because the risk to everybody else might be very, very low, if not zero. It's never a zero risk. If you go to a grocery store, you go anywhere out in the public, you are potentially getting exposed to somebody who may be out there with COVID-19 and asymptomatic.
One of the issues that we could very well be faced with is that scenario. But then what happens is that the rumor mill runs rampant, and all of a sudden everyone is hysterical, right? And that's what we want to avoid. So sometimes being able to be a little bit open with the circumstances and the context will help keep everyone a little bit, sometimes more information just helps people just not jump to conclusions as well. So, I don't know where you draw the line, but I just want to avoid a case where you do have a case, let's say, that there's someone in schools, but the immediate, it's definitely isolated, but it is someone that's in the district, either staff or student, and through the rumor mill, it becomes a big deal rather than being able to be upfront with the facts and just stop it before, before it just takes a life of its own.
Well, I understand that. Give it some thought, because you're going to have lots of students going out through the year for the common cold and maybe flu.
True.
The school, the people around the student may not know that they're positive or not. They're just out of school. Under HIPAA, the health department cannot disclose any information that a student was positive. So yes, a student left school not feeling well. If people can assume whatever they want. I don't know how the school would know that a child is positive or not unless through the contact tracing we've reached out and asked for some help. It's a sensitive subject. I do understand your situation. That would be a school decision policy, whether you want to inform everybody or not. I don't know what the appropriate point would be. Certainly, maybe after somebody has a positive diagnosis and it's more than one student involved, and there's maybe some trickling through a class or a particular school. Tricky situation. You don't want to create a hysteria. You certainly want to keep people informed. The appropriate time to do that, I think, needs to be evaluated on a case-by-case basis.
Sure.
Tony, if I may, and again, the section that Mark edited that is his should assure everyone that once we get any one situation, Mark and I, other administrators will be, and Dr. Laura Marks will be in deep conversation about your exact question from a communication standpoint. And we actually had to do this back in March as COVID-19 was creeping in. Many may remember that Westport, Wilton had to close, Weston didn't, but then suddenly Weston did. And that was based on good, close consultation with Mark Cooper. We know more now, and as Mark has said, we know enough that one may not lead us to close or not. But yeah, I can assure the community, it's now written in black and white that any one situation, administration will be working very closely with Mark Cooper and Laura Marks on exactly what we can share and how we can share it within the laws for privacy.
I also would like to underscore, I completely agree with everything that Mark said, and he wrote a beautiful thing. I was so impressed with exactly what you're discussing, that document about how we're going to handle things. And I will tell you right now, I'm not, but we are at Willows seeing patients all the time already with fever and symptoms that could come under the COVID diagnosis already, even before flu season.
Can I ask a question about social distancing? We have the guidance from the governor regarding the risk categories related to the number of cases on a 7-day rolling average. And as we move or look to move between our models of education, hybrid, maybe a full reopen or something in between, we would probably lose our ability to keep and maintain a 6-foot social distancing. I'm wondering, assuming the numbers put us in the low risk category as defined by the governor, how comfortable are you with something less than 6 feet in social distancing?
Well, right now, as you said, the rates are very, very positive, very good in Weston. We're by far under the state's transmissivity ratio there. The less the 6 feet is, the more other controls you need to make sure are in place. Again, the masking, hand washing, good air ventilation. I'm comfortable, 5 feet, I wouldn't get too excited. A lot of the state guidance says 6 feet when possible. So they recognize that 6 feet cannot always be achieved. If you're telling me you're going to have people 4 feet apart and always wear masking and you've maximized ventilation in the classroom, I'm okay with that. Again, you're trying to get the kids back to school. That's important to do. You're trying to maximize everybody's safety, students and staff. The closer you get, the more you have to have other controls to help prevent the spread.
Can you talk about antibody testing in terms of if students are getting antibody tested and they're testing positive, can we then have that cohort be together feeling like they, are sort of safe to move about and not have to worry about all of these factors, or is that not even possible?
Dr. Marks might disagree with me here, but I'm going to say don't waste your time and money on antigen testing at this point. It brings you no value in terms of knowing whether somebody should be or should not be in school or getting the.
I completely agree, and I know I've spoken to the ID folks at Yale. They completely agree. It's a waste, complete waste.
That information will be very helpful in future epidemiological studies of how all this unfolded. But in terms of a practical usage in a community or a school district, don't do it.
Because the tests, well, I'm not going to say because they were rushed, but there's a lot of cross reactivity with other coronaviruses, which is just the common cold.
Yeah, that's an important point. This COVID-19, the common cold is also a COVID virus. Obviously, there's differences, but that's kind of why there's issues going on here. COVID-19 comes from the same virus group, if you will, as the common cold.
Any other questions for our medical professionals?
I had one more question about coughing.
Sure.
So could you, I guess when I think about it, I think about as that is like somebody coughs and everybody runs away. So I mean, we're talking about taking temperatures and you're saying, well, that's not really a good indicator. Well, what about coughing? And if somebody coughs in a class, should we just like automatically send them to the nurse? Can you give us a little guidance on that?
I'm going to defer to Dr. Merckx. I mean, I cough every now and again for, I think, no reason, and I'm sure kids do the same. A cough does not mean they have COVID-19, of course. I think it depends on the severity, all that sort of thing. I'm going to let Dr. Marks handle that one.
That is such a difficult question because coughs are so multifactorial. You can cough because you have asthma, you can cough because you have reflux, you can cough because you have a cold or the flu. So I don't think, or you're choking on your saliva or some water. I agree. I think, you have to put everything, like everything else, you have to put everything in context. So one or two little that kind of thing, or coughing on some saliva, not a big deal. But if you start to cough, and teachers and nurses know this who are in the school, if you start to have a cough, you shouldn't be in there. Now the nice thing in terms of the fact that they're wearing masks, that masks capture some of these coughs, and that's why you have to, because it wouldn't be the first cough, it's all over the room. The first cough, it's in the mask and hopefully capturing most of it. And you have a chance to not infect everybody, hopefully a good chance.
Thank you.
I think everything is so fluid and it's so difficult to interpret, but I think as you go on, hopefully it gets better. But it's worth noting that everybody is confused. There's so much different information. Doctors are all doing things differently. Everybody's trying to figure it all out.
But to add to that, Connecticut, Westport, Weston, we're in very good shape in terms of the low rates that we have. So you're in a very good starting point. And I certainly would recommend a conservative approach. See what's going on as other school districts open up and maintain that flexibility. If our rates stay low and we see the level of any community spread decreasing, that tells you can move in a new direction. If we see things starting to spike, as some of the concerns are at the moment, then you need to keep very stringent controls in place. So we're in a good place now. I think you're in a good spot to open up. I think you should do so conservatively and see what happens. We don't want to be the experiment they did down south where kids are getting sick because they just let them go into schools without any kind of controls. And now they're having to rethink things big time down there. So we don't want to go backwards. Let's keep moving forward in a very safe way.
I would echo that, Mark. I don't think you could have said it more beautifully. I think you guys have done a fantastic job in the town, and the fact that the rate is so low right now, and just doing everything as safe as we can, and being very much in communication, as we all have been, with each other to try to act on any changes quickly, and to just give each other communication and support that is needed to do this, because the kids are the most important thing.
Sorry, one last question with regards to recess for the lower schools. When the children are going to be outside, they're going to be running around. They could or could not have masks on. How do you feel? I would imagine children for recess being closer than 6 feet apart. With masks on, is that acceptable?
With masks on, you can be closer than 6 feet, but the point of kids having recess is to get out there and blow off steam and run around and that sort of stuff. It could also be part of your mask break time, if you will. How do you control kids and keep them 6 feet apart? God bless you. I don't know how you're going to figure that out. It will be hard. I think part of the training, go ahead.
I was going to say, so being outside and being 6 feet apart or more, the children don't have to wear masks. That can be their break.
Run around. Yep.
That's what we're hoping. That's why it's so nice that the weather is nice now. We were hoping to have mask break outside and let them run around. I completely agree. I'd like to keep them a little bit further apart, and hopefully educate them so that they can stay a little bit further apart. But I don't know. I agree. I don't know how that's going to be achieved.
Yeah, Ruby, again, the shared commitment document that's out that talks about the mask breaks, that wording in there came directly from Mark Cooper and Laura Marks. So I appreciate you raising that question. And again, we're going to see how it goes. But a very helpful question, Ruby. Thank you.
The other thing that's on my mind is the younger kids. How young, Mark, I didn't catch this because I was, having that power outage, but what age are we going to start having them wear the masks?
Let's see. Well, the way the guidelines are now is anyone under the age of 2. I've been dealing with some of the preschools and they're grappling with that question. Preschool kids don't want to wear masks either. So that's a tough one. I think anybody in a school setting, guidelines are if you're in public and you're going to be less than 6 feet apart, you should be wearing a mask, even the young ones.
Yeah, agreed. They may need, a few more recesses than usual. Yeah, agreed. That's exactly what we say.
Any other questions from the board or anyone else on the topic?
Just so you know, also, it's such a difficult disease because, you can present in a variety of ways. You can present with, upper respiratory cough, congestion, fever. Of course, everybody knows about the loss of taste and smell, but also, GI symptoms can also be a presenting symptom for children.
I had a question about cleaning protocols. So should we have like each kid wipe down the desk after they use it? I mean, what are your recommendations on all of that?
Well, they do recommend frequent cleaning. So, if I'm staying at my same desk all day, it doesn't have to be wiped down in between when I take my mask break outside or something. But yes, anytime there's a change of people to a desk or materials or anything, they should be sanitized, washed down, depending on the nature of what they're made out of. So frequent cleaning is recommended between different users.
Can I ask a quick question about lunch? So we're thinking about having our kids have lunch in the classroom. So that means they need to take off their masks. Thoughts? I mean, we're talking about 11, 12 kids in a classroom at their desk.
Well, the idea in the classroom is so that they're not congregating in a cafeteria where they tend to get a little more wild. In a restaurant right now, it is acceptable for 25 people unrelated to sit at a table and take their masks off and eat a meal. So you're basically almost talking the same sort of what's an average classroom, 22, 23 kids, something along that line. So long as they're sitting at their desk, hopefully as far away as 6 feet as they can get, eating their lunch, that's no problem. It's safer than going to the cafeteria where there's going to be a lot more people all getting together. Again, not perfect, but the world is not perfect either. So we're trying to do the best we can with the resources available.
Thank you.
Dr. Marks, I know that you're seeing a lot of young children right now as well. What kind of advice would you give our teachers for the incoming kindergartners on how to deal with an emotional student? These are young ones coming to school for the very first time. And, we could have children that feel uneasy or get homesick or start crying. How would you recommend a teacher handle that situation in terms of hugging that child? I think, one of the things that's so special about Hurlbut is our teachers are known for being lovey-dovey, right? They're the mom away from home. So how would you counsel teachers on how to deal with a situation like that?
That breaks my heart because I remember my kids going to Hurlbut and the first day of school, the teachers hugging them as they walked off the bus. I completely agree with you. I think that, I've been through the school system with my children and they just are fantastic teachers, fantastic. And I think that they're going to find other ways to show love. I have to say, I'm dealing with the same thing at work. because I have this mask on and you're not allowed to, hug and be so close to them. We're trying to also have a little distance as well. I think they're going to have to use other methods, I think, and it's not even going to be able to be facial expressions because you got the mask. I think it's going to have to be their tone of voice and their calm and their words. And it does break my heart. This is one of the things I think every day about all of the kids in every single different stage of development and what they're going through. And it's another thing that they're going to miss out, that I hadn't thought of until you said it. But, these teachers are fantastic. And I think that they're going to find a way to be there for the children and to connect in a different way. They'll be creative with their voices and their tones and what they do with them, their activities with them have to be comforting. It's sad.
You.
I'm sad.
It breaks
so
my
much of
heart.
it.
I agree.
It really does. I'm sad about the newborns and 6 months old that can't see my face when I'm examining them. I'm sad for the teenagers. Every bit of this is tough. I agree.
Bill, unfortunately, I got to push for any future questions, other questions. I've got to start rolling here. Certainly, I'm available. Additional questions. Bill knows my number. So again, any other questions? I apologize, but I do need to get running here. And
Mark,
more than
can I just ask you a very quick question while you're still on? Willows is having a trouble because we're trying to figure out how to do our flu clinics. We usually bring everybody through. Obviously, we can't bring everybody through the building at this point. We're doing drive-by, and we're all happy to donate all of our time. We're actually going to fund it because we're going to pay the nurses and so forth. But we don't have a parking lot that's big enough to do this. We're going to do probably Saturdays, in addition to some of the days during the week, having people in our parking lot. But we need to do a mass, sort of Saturday, a couple of them. I'm wondering if either the health district or any of the schools would be willing to work with us to let us use some, any parking lot.
Certainly, health district, we can talk about it. We're also talking about how we're going to run our typical flu.
Yeah.
And we're talking about doing a drive-through outside under a tent sort of thing. So maybe we can combine efforts that way. But certainly, we can talk
Okay,
about.
so we'll talk together at another point.
Sure.
Great. Well,
thank you so much.
Thank you, Mark. Thanks for joining us. Thanks, Dr. Marks. This was extremely helpful. I think providing the context that really led to the administration's decisions around the mode of reopening schools, I think is extremely helpful. If there's no other questions, I'll let Dr. Marks and Mark go, and we can move on to other agenda items. But thanks again for spending the time with us.
Thank you.
Bill, do you want to move to the next? I guess you can combine number 2 and 3, right?
Well, by my count, the next one is, I see you're saying in terms of any state update.
Yeah.
I think at this point, I'll be brief for the board in case there are some different members of the public who've come on for an understanding that there'll be substantial focus tonight on middle school and high school. The basic regional update, and almost every hour superintendents are texting each other, emailing each other, trying to clarify what's going on. And as I said last night, that's really most valuable as a communication process. So there is some consistency and some understanding how to deal with these vexing questions, many of which you've just dug into tonight. But I'll know more tomorrow, have a 90-minute Zoom once a week with the supers where we really do share. At this point, all in this region are opening up hybrid, looking to go either from a phased hybrid early releases. That's our strong recommendation. Looking to, as we then get into October, considering a full day hybrid, keeping an eye on a full reopening. As was discussed here, our really fundamental issue is the social distancing. We can keep coming back to that because we actually would be, I think, within about 2-3 feet of each other if our classrooms had students fully back in and all that. But we will continue to look at that. that matches with all but right now 3 districts in this region, with Bridgeport, Greenwich, and Norwalk bringing in their elementaries, in some case K-5, other K-8, but typically middle school and high school, at least there, are hybrid. But again, everybody's phasing in. It's really, I think Mark Cooper put it best. You know, we actually really lead the nation now, Connecticut, in this health marker. And it's trying to make sure we don't fall into the mistakes that other parts of this country have fallen into, which is forgetting about social distancing, forgetting about masks, forgetting about hand washing. And you see, as schools open in other parts of the country where they've not been rigorous on that, have rushed in too soon, you see the data, you see the evidence. So I think that phased approach is what makes sense. And really that's the regional update. State update, a few months ago, we were incredibly frustrated by lack of help, lack of guidance from the state on any of these major public health issues. We now have excellent guidance, and that's in the document that I submitted to the board yesterday and is up on the web for the community. We have excellent guidance on 3 scenarios, or the most likely scenarios if we have COVID-19 exposure and how to proceed. And as you heard, both Laura Marks and Mark Cooper rightly celebrate their own work. That's their work in that document. So that should assure the board, staff, and families that on that top indicator, top priority of health. So that's my little regional update and state update. I think if you do have time today, board, you do want to hear a bit more from Tracy Edwards in terms of, as you know, yesterday, I think about 4 o'clock, the state sent out major updates on how to handle gen ed and our special ed population. She's been working it rapidly all day to figure out how to make that a reality, working with principals, consulting with other directors around the region. So I would urge you to get into that update. But otherwise, tonight is a night to talk more about the middle school and high school, than for you to deliberate on sort of where you are on a decision on the reopening. But I would urge you to, and it would fit naturally within your discussion of the middle school and high school, to turn at some point to Tracy Edwards. The other thing you've not done in last night or tonight is dig into sort of the technology tools that may be natural to do within the middle school, high school. You as a board invested this summer in upgraded technology, and that is essential to what we're going to be trying to do in the hybrid. So this might be a good time for you also with Dan Doak, then Dan DeVito, Lisa Wolak to get into those questions. So I would urge you now to move into the middle school, high school discussion. But again, please make some time to hear from Tracy as it relates to SPED, and Dan DeVito with maybe then Ken Craw on the technology piece.
Mm-hmm. Great.
And of course, after we're all done with that, we have athletics. So we don't want to forget that. And you do have documents, and they're posted for all the community to see, that Mark Berkowitz has put together.
All right, maybe we can move to Lisa and Dan to talk about the upper schools and the reopening plans.
Okay, I'm happy to start. So last night we heard from Patty and Laura about the lower schools, and they mentioned how each classroom has its own schedule. Well, the middle school and the high school are very different. We have a very distinct bell schedule. And some of the first things that I needed to do for the middle school was look at our schedule, try to make it compatible with the high school, as well as to take in some of the lessons that we learned during the spring when we were doing our virtual learning. We needed a schedule that we could have work under various scenarios. And the first thing we did, as I may have mentioned earlier, is we took lunch outside of the schedule. And we were able to come up with an 8-period day. And Mr. Phillip, Ms. Gavoni, and Mr. Walters, the assistant principals, worked in tandem to create a schedule that also allows us, for students that we have a few students at the middle school who take high school classes, and we needed to make sure that that was still possible. And we have shared staff, not just with the high school, but we actually have shared staff with some of the lower schools as well, which is another challenge. And so I should actually thank Kim Koos and Nicole Wilhelm also for the work that they've done throughout this process and are continuing to do as we fine tune the staffing in this very complex, complicated sharing of staff and scheduling. So with our 8-period day, the recommended reopening model that we have in terms of a schedule is 4 periods of live instruction in the morning by cohort, by the district blue and gold cohort. So when the blue cohort comes, families with last names A through K, they would have periods 1 through 4 live. And then they go home on the bus or with parent pickup and have some time and then engage in distance learning in the afternoon. That's why this truly is a hybrid. There is an option for everybody to attend both in-person classes in the morning every other day or afternoon distance learning every day for everybody. It also accommodates our voluntary distance learning families as well, those families that have chosen not to enter the building. They can stream in using that technology toolkit that Bill referenced and stream into the classes in the morning from home, but fully participate in the distance learning that takes place in the afternoon. We have made some other modifications. One of the things about this schedule for us is it also avoids having to do lunch periods in the school, which we found to be very problematic at the middle school and the high school, given the number of students and the space available. In terms of other things to the program, we are committed to making the entire program accessible to all. Again, whether they're in person or distance learning, voluntary distance learning. We have made the decision that our co-curricular programs, our clubs at the middle school would be virtual, and therefore they would be virtual and available to all. I want to make sure that's very clear because I had several questions about that. There have been some other instructional issues that we're still dealing with based on the social distancing guidelines that you just heard about. We know that our large ensemble groups in music are very challenging. Those at the middle school are called PFAs, any of our specials, and they meet live in person at the middle school on our schedule by cohort. So it's only once every 8 days that those PFAs will meet live. However, they do meet 2 other times in the 8-day cycle virtually as PFAs. The academics meet much more frequently, twice as frequently. Some of the issues that we were also dealing with at the middle school in particular is the locker issue. We will not be assigning lockers this year. We are trying to avoid any congregating in the hallways. To that end, we are also attempting to not only cohort by team, but we are trying to keep our first period classes together. Those students, we want them to stay together as much as possible and have the teachers rotate from room to room. There may be times, in fact, as we're doing the schedule, we're scheduling the students and teachers and playing this out. There will be times when students do have to leave that first period homeroom class to go to some of their specials, some of their world language classes, music classes, etc. But our goal is to not have large groups of students passing in the hallways at the same time. So we are not going to be using our bells during this hybrid 1 option. We will be having at that time, when there is a time when teachers, when students need to go to another classroom, to have them escorted either by the teacher they're leaving or by the teacher that's receiving them. We are very concerned about drop off and pickup. I think Laura and Patty said the same thing. With some of the data that we've received that indicates that parents, a large percentage of parents are intending to drive their students, which I think makes a lot of sense given the circumstances. But we have lengthened our first period class more than the other periods to make up for both the lag time in kids being dropped off, as well as we want some time to, when they're in school physically, to attend to some of the social emotional needs of the students. with their homeroom teacher, their first period teacher, in that home-based room. Traditionally, students would congregate in the cafeteria where they were supervised before the start of school. This year, for obvious reasons, we are asking students to proceed directly to their first period classroom once they arrive at school. I think I've covered most of my initial talking points. I think Lisa, if you want to go next, you may have some other things that may mirror exactly what I'm talking about. And then I'm happy to answer questions as well.
Would you like me to continue, or do you want to ask middle school questions first?
Why don't you go ahead, Lisa, and then we can take all the questions at once.
Okay, sure. Thanks, Tony. So the way we set things up also with the high school is in a blue and gold cohort. We have 8 periods a day, 4 in the morning, 4 in the afternoon. Distance learning takes place in the afternoon. The 4 in the morning will be done in person, whether you're in a blue group or a gold group. It's done by alphabet. All the courses are being offered at the high school. I said that last night. I want to emphasize it again. There's credits attached to it. Just because a course is an elective does not mean that it will not be offered. They will all be offered, and both the voluntary distance learning students and students have access to those courses. One thing that has been coming up is, question that was asked was about time. What are you going to do? How much time are we losing on the curriculum? So, we actually did the schedule kind of similar. It's confusing, and I plotted it out because the devil is in the details, so students can actually see what are they doing, where are they going. It is an 8-day rotation still. I won't get into the weeds with it because if you know nothing about the high school schedule, it will just confuse you. But the bottom line is this. In that 8-day cycle, the classes meet 6 times, which is what they usually met. The classes are only 40 minutes as opposed to 56, which means that there's 72 minutes less in an 8-day cycle. 72 minutes, but you have another 160 minutes extra on the days, the mornings that you don't come into school. And our teachers understand that, and they will be providing work on those days for the cohorts that aren't there. So the concern that, oh no, how are they going to get through the AP curriculum? What's going to happen with a particular science course? We do have labs, which was different than in the spring. We worked out a way to provide the labs and to provide the PE opposite the labs and all of that. So we're really pleased with the schedule, the way that it looks. Because instructional time, I think we're going to be fine there. Cheryl Zolkowski. Excuse me. Don't know why I'm being called. Talk to you later, Cheryl Zolkowski. As far as supports go, supports with virtual, voluntary, distance learners or in-person learners can access these supports. Writing Center, Math Lab. If you're in the Center for Academic Support and Enhancement, you will be able to receive training in the dialectical behavioral therapy in 9th and 10th grade health. All of our upperclassmen will be able to participate virtually with college visits. All college visits will be virtual this year. The guidance seminars, the counselors that run particular groups for counseling, all of them will take place in both a virtual and in-person setting, some of them like the Writing Center, Math Lab, and health. But the point is that every student will have access to these no matter what they choose. There are office hours. We heard last spring that it wasn't as clear. We are using one system, it's Canvas. We're not using 2 different systems, Canvas and Google Docs. And or Google Classroom, sorry. And so teachers will post on Canvas on the front page by the first week of school what their office hours. Students can access them both if they are in person in the building and have a quiet study, or if they need to virtually. No lockers at the high school. We have plenty of lockers and the kids, for whatever reason, don't use them anyway. So that's not a change. No changing in PE. They're only in for 4 hours. If they need to take a shower, they can take it when they get home. We are going to be using our outdoor courtyards. However, we are going to be using them with certain protocols. If certain areas are for mask removal, relief, if certain areas are for the choral group or band sectional, that kind of thing outside. Clubs are virtual, and some people say, well, why can't the clubs meet after school? Why can't the clubs meet in person after school? One of the principal reasons is we opted, unlike other districts, to go for the full 5 days. We're not taking a day off for deep cleaning. When the students leave the building, we have to start cleaning the building. And the teachers that are providing distance learning will be going to other different locations, perhaps, to provide the distance learning, but they are not available to monitor the clubs. There has to be supervision. And we can't have them in the building later in the afternoon when the building has to be cleaned, because then, we simply cannot clean the building again. So I wanted to make sure to address that concern. The other thing is I know Mark will speak specifically about athletics, so I don't want to take away his thunder. However, athletics is available for all the in-person students. We did make the decision for the students that are doing voluntary distance learning that they would not be participating in in-person athletics. And I explained last night, but I'll allow him to explain a little bit more about that. So the devil is in the details. I know that people want to know, well, what specifically is it going to look like, especially with the high school schedule? You have blue days, gold days. You have different rotations within that, gold A, gold B. It sounds a lot more complicated, but I will be sending out at the beginning of the week the schedules to the students and staff so that they can actually start studying and looking at the blocks and understanding how they work. So now we can entertain any questions.
Lisa, there's just one other thing I wanted to add that I thought about as you were talking, and that is, a lot of what we're trying to do at the middle school is kind of a combination of what the elementary school is doing in terms of trying to keep the students in cohorts, and yet trying to accommodate a schedule that's much more like a high school schedule with different teachers and different disciplines. And I want to thank our school counselors who have been hand scheduling students this summer in order to make the system work. It's been a lot of work. It's been different than what we normally do. And I just thought I should recognize them at this time.
Dan and Lisa, just to be clear, just because of health and safety considerations, what will not be offered, right?
What will not be offered?
Yeah. So
it's hard for me to think, Tony, frankly, of what will not be offered. I think that it is offered perhaps in a different
right.
way.
Well, that's the point of my question. I mean, that's exactly the point of my question. What is it? Let's look at all the health and safety considerations, and let's kind of say, what are we missing? Right. That's really my point. What are we actually missing? Whether it's voluntary distance learning or creating a schedule that is hybrid with all of the health and safety considerations. Where are we? What are we missing?
I think the biggest thing that I would say, and this is really, it came straight from several students that have emailed me over the summer. They're missing out. We know that developmentally, this is the time, especially in early adolescence, middle school especially, when students should be orienting themselves towards their peers, and we're taking that time away from them. And it's the sadness that Dr. Marks was talking about earlier. I've had students contact me directly and say, I fall at one end of the alphabet. Can you make an exception and put me at the other end of the alphabet so I can be on the other cohort with all of my friends? That's what makes middle school so enjoyable for students. And so by not having lunch and not having recess and not having lockers and not having passing periods, it's all of those rites of passage of middle school and growing up and maturing that kids are missing out on because of COVID. And we're trying to do everything we can to acknowledge that and to address that. And we'll be doing that through our social emotional lessons, but we can't make up for that piece of it.
I guess I would say in looking at, yes, of course, there's the social emotional piece, there's the friendship piece, there is, I mean, please let us have a prom in spring of 2021. If we don't, they will all be so sad. But in looking at it, for example, through the academic lens, I would say that, you know, perhaps there are considerations, you know, when you go from a 40-minute class to a 56-minute class, there's considerations of science labs, there's consideration when you're in person of particular equipment that you would be using in art classes, in the visual arts, in videography, for example, in engineering, in certain areas that rely a lot on that those kinds of mediums and the ability to touch things and everything else. Well, we certainly want them to experience certain, you know, instructional tasks, if you will, labs and things. They will be clearly modified in this kind of a setup. Students that, you know, we have a beautiful language lab. We can't use the language lab because I need to use it as a classroom because it's air conditioned and it actually provides really good social distancing with the boxes. So then, you know, you can't use that. So you have to figure out another way to do the same kind of task. One of the areas that I am concerned about is Project Lead the Way and the intricate software program that is involved with that for our pre-engineering students, because it is, we are not sure how we could replicate that if students did not have access to be able to come into the building and work on that particular software. Some of the other things like contemporary media design, things like that, we were able to make adjustments. But with Project Lead the Way, it's much, much harder to figure that out. So that's, you know, that's going to be a challenge. Field trips, you know, when I think of going to competitions, doing things like that. One of the positives and one of the opportunities that we had this spring was we had so many incredible people come in virtually into the classroom. It even continued this summer. We had a wonderful, you know, summer voluntary book group reading. I joined one of the books, absolutely fabulous. The author came right into, you know, the group and talked to us. So, you know, you keep trying to adjust. I mean, those are real opportunities to be able to contact people. You know, they were talking to some woman from Iceland and virtually streaming her in the classroom. I don't know how they even figured that out. But then there are other things like, I don't know about some of the activities like the debate and the Model UN and the mock trial. We take a lot of pride in those competitions, Science Olympiad, all of that. We don't know what's going to be going on with those. So, but then again, I think that the other schools, we're all in the same boat. And that's what is unfortunate.
Yep. Questions from the board?
I have two questions for both of you. The first one is with regard to scheduling. Would you be able to have the core subjects for students in the morning live and then the specials, we call them at the lower level, in the afternoon when you're doing the distance learning?
I can try to answer that first. It wouldn't be possible for the middle school because those teachers are teaching all of the students. In other words, the specials teachers teach 6th, 7th, and 8th grade. So they can't teach all of the students at the same time. We have to spread it out. If I understood your question correctly, we can't lump it and say, so half of the teachers aren't working half of the day, and trying to get it in so that would work. In addition, some of what you're calling specials in terms of our PFAs do require in-person work just as much as the academics, and sometimes even require special equipment or special rooms. I'm thinking of like our tech and engineering rooms or art rooms. Obviously some of the musical classes where you are manipulating instruments. And I can remember actually in the spring watching one of our administrators who has a child in my district trying to learn how to tune a string instrument via a Google Meet. Some of those things just don't work as well virtually. So I don't think that we can have a, we can't relegate all of our PFAs to the afternoon, especially if that meant relegating them to distance learning. And the other thing that students have said loud and clear is sometimes it's those PFAs that give them a break during the day, even if it's during part of the day, to engage in something that is just different. And some students find it that's what gives joy to their school experience, whether it's music or art or tech and engineering, a project challenge, or one of those other PFA courses. I don't know, Lisa, if you have something else to add, but I just don't see that as a viable option.
Yeah, it's not an option at the high school.
Dan, when you were talking about trying to group students so teachers would rotate in based on the answer to the question you just gave, for PFAs, science, they're going to be going to those classrooms?
So Gina, thank you for that question. Sometimes this is still a moving target. Drew and I were walking the building again today, and I think I need to reach out to our teachers to see what's the best option. And it may be different by grade level in terms of science, either staying in the science classroom or having them move closer to where their team of teachers are. That would make a big decision about whether or not the students go to the classroom or whether the teacher rotates. Certain ones, the students we know will have to leave their first period class homeroom to go to one of their specials, and possibly world language, even though that's considered an academic in 7th and 8th grade. But it's a challenge. That's one of the fine tuning scheduling conundrums that we're still wrestling with.
And then another question. Pre-pandemic, your teachers were wonderful about using the team homework calendar. And that's drilled into those 6th graders from the day they walk in the door, that's where you go to look for your homework. Post-pandemic, when we all had to kind of like start using Google Classroom and teachers were getting accustomed to a new skill, homework was being posted in a lot of different ways for these kids. Is there going to be one set way that the teachers post homework, that the teachers post the assignments that the kids are supposed to be working on their morning at home? Are we going to have a concise way that the entire either team or grade or whatever is appropriate, that we're going to be following that?
Yes, we're going to leverage our team leaders to really work on that and to really help with the communication team-wide, and communication not just with the students, but also with the parents. To make it easier for everyone to find the assignments. Because you're right, that is one of the strengths of the middle school model, having that time during the day, which is another reason, I guess, back to Hillary's question, when those students go to their PFAs, that provides time for the teachers, and it may be virtual this year, but they can connect, they meet. Typically they meet 3 times a week to talk about students, whether it's social, emotional, academic, behavioral concerns. They also talk about team assignments, calendar. They talk about activities in whether there's going to be a guest speaker, virtual or in real life. And hopefully we'll get back to a point where we can have field trips again. But that's all planned and organized by the team of teachers. Remember, at the middle school, one period a week is also set aside for team conferences with parents. And that happens throughout the year at the middle school. We don't just do it a few times a year on a few different days. It's time built in. And it's usually facilitated through our grade level counselors, who again work well to support, to advocate for students and help communicate with families.
I'm just curious, for the middle school, I know the high school is a different animal, but for the middle school, was it ever a consideration to follow the lower school schedule to have more in-person instruction time? Or is it just not something we would consider because of logistics?
I think it's because of logistics. I think when you think about the middle school schedule, it's much more like the high school. Partly also because of the different certification issues that we have. We're more like, it's more of a 7-12 certification rather than the K-6, where a classroom teacher can stay with the students and divide up within that time what subject is taught at what time by the same teacher. These students have to go to the teacher who's certified to teach that subject.
So Dan,
I had a
this is
question. Oh, go ahead, Gina.
Oh, Dan, my question's a little bit of a loaded question, but I'm just going to ask it anyway. What's the one thing you wish you could do differently to make the hybrid model better?
You know, I'm gonna have to think on that one. I think there's some tweaks that the high school and middle school have been talking to about already, just in terms of some of the timing, just maybe some adjustments to our minutes, to build in maybe a few minutes for passing period, even though there's not going to be a passing period, but just in terms of, we know there's going to be lost instructional time as teachers move or as students move. So that's one of the things that we've been thinking about. You know, we've worked and thought about this one. So I think that we've gotten to a point where we're pretty good. Obviously, you know, if that means there's a suggestion you have for us, I'm happy to listen to it. But we really worked hard on this. And like I said, there's still some struggles trying to make it work. I'm still a little bit with the world language piece of it, with the science rooms. You know, one of the things that Lisa and I really didn't talk in detail about, although she alluded to, is the fact that we've got significant portions of our building that's not air conditioned. And we're trying to work around that. You know, it's in terms of, you know, finding some solutions so that students, you know, no teacher, no student is going to be in an unair conditioned space in the heat of September without a break. That just can't happen.
Yeah.
So,
Gina, this is Ken. One of the other challenges that I know Dan is facing is the shared staff between other buildings and being able to schedule those. You know, it's difficult enough with the schedules that are traditionally used, and now with new schedules in place. I know that Dan and Drew have been working really hard, as well as the other principals. So that, I mean, that's just one of the, staffing is just a challenge with any of these models.
No, understood. And Dan, I know you have turned yourself inside out trying to figure out the best possible thing, but I had to ask the question to see if there was just that one thing I wish I could have done.
We talked about this yesterday. I just want to confirm, because there was still a lot of the public unsure about this. For the live streaming, when the blue cohort is in person in the classroom, will the gold cohort have access to that same live stream? Granted, it might be repetitive because they had just probably gone through it the day prior in person. But I guess my question is the live streaming open to anyone in that class, whether you're a distance learner or you're at home on an off day?
I'll answer that first. No, I imagine if someone were ill and needed it, you know, I'm thinking of kids that they got sick and they need to come in, that's fine. But Other than that, no. I mean, there's, especially at the high school level, the teachers are very aware of the time that that the students, there's 160 extra minutes of time in those mornings that they are not in person, that they're going to have other work to do. So I cannot see the reason that they would be participating again. The other thing is if they saw the lesson and then they log in again to the same lesson the next day, quite frankly, that's where you have, especially with the younger ones, potential of discipline problems because they've done the work. You know, if they need that kind of reinforcement or they have questions or things like that, then that's where at the high school that they need to address it when everyone's in distance learning, or they need to go to a teacher's office hours or shoot the teacher an email. But opening it up, because again, the focus on those days of in-person is really working with the students in person. And as Dr. Cross said yesterday, the people that are the students that are watching, it's like a window to the classroom. And when you start muddling it with having kids that have already seen it, that gets very, very tricky and complicated. And we want to provide the most rigorous instruction without distractions of management. And it becomes a classroom management issue, in my opinion.
But aside from disruptions, don't you think it's an opportunity if a student found that particular lesson engaging or really interesting? It's another opportunity just to have it sink in a little bit more or to understand a little bit more.
You know,
and it's not just for high school. I quite frankly, this is probably applicable to all 4 schools,
sure.
right? It's not just you.
And I understand where you're coming in. And please understand, this is what I believe in looking at high school. The high school program is very rigorous, whether you're in distance learning or you're in person, and now it's a hybrid. To be blunt, I do not believe, in my experience of working with adolescents, that they are going to log in again to see another lesson. They, because of the type of courses we have, the type of academic expectations, they will simply not have the time. Part of the reason we said, you know, gee, what are they going to do those 4 mornings? I was talking to one parent and I said, you know, there's work that's provided. But the other thing is, quite frankly, is adolescents like to sleep, as we all know. And it provides them, you talk about that social emotional piece. I know you high school students, you will not probably be up until 10 o'clock on those mornings, but then you'll be doing the work later in the day. So you know, I get what you're saying, that if they really were enthralled or wanted to do something, but that's where the teacher's expectation of the task or the homework, and we spent a lot of time with that in the spring. The input at first was from the students within the first 3 weeks. You're giving us busy work, stop it. We want to be more engaged. And the teachers really worked at moving away from that and making it high quality work. So I think I've shared enough.
Well said.
I'm clear on being, but Mr. Doak, if you'd like to.
My 31 years of teaching experience brought me to the same conclusion in terms of how students would react about tuning into a class they've already seen. But I also think in terms of the students in that cohort, whether it's the cohort that's physically present or the cohort that's tuning in from home, that's their time that should be dedicated for them. Each cohort has that limited precious time. And I think somebody who's already been in it from the other cohort shouldn't really be interrupting that time. And I do worry that it would be an interruption.
Can I ask a follow-up question to that, which is that, well, with all these kids that are going to be sick all the time, are these lessons recorded? So if they want to sleep in and then, you know, on their off day or on the day that they're sick, start later, can they go online and see a recording of the class?
If I could chime in here, the classes are not recorded as a whole. Again, I think for the same reasons that Lisa and Dan have cited. However, one of the strategies, I mean, we really need to look at instruction differently, because there are times where snippets of video around direct instruction could be very helpful if recorded and posted. If, for example, a math teacher is going over a particular problem or concept in a very short, 3-minute video, 5-minute video that they record could be posted. So that can be really helpful for a student, as Ruby alluded to, that may be going back and seeing something, but rather than having to sit through a whole class and find, where that resource is needed for that student. So there are strategies, I think, like that can be helpful for students, and even as they're maybe coming back, to study for some kind of assessment. But in this instructional, framework of sort of a 2-day chunking of work, 1 day in person, 1 day at home, we also have to think about, how we leverage more of the project-based types of experiences, performance-based types of experiences as well. So it's not, just what the teacher is saying in the classroom. They do release responsibility to students to take ownership of their learning, but they certainly need, and I think, some snippets will be very helpful. It's something that we've been talking about with the curriculum leaders as they're now meeting with departments, to talk about what's best to do in person. How do we provide, the work on the days that they're not in? So, and I think, we're seeing ways that we can reimagine, learning.
I think we need to be a little bit more black and white with the public. It's not yeah, there can be some examples where we record the class or we don't. Either we record all classes or we don't record all classes.
We are not recording all classes.
But I'm not understanding why. Is this if there's an option to record this Zoom session right now with a click of a button, why couldn't we do it for the class?
I think for the same reason that Dan and Lisa, have.
They cited on why they wouldn't open it up to people who've already attended the class, not why they would not record the class.
I'm still not following. What would be the purpose of recording the class for students that have already taken the class?
Again,
I think that one of the issues, I think that this is where the board, the public at large, I think what we're seeing through this pandemic is the door has opened up to this K-12 live streaming, right? And I think there's going to be an evolution, right? I think this is probably the start of something that will evolve over time in terms of how live streaming is used, how it's saved, how it's then going, and how it's used afterwards. And I guess the question becomes, I think the question is that regardless of how we intend on using a class, is there value, right? I mean, how you intend on using the content is ultimately up to the educators, right? But is there value in recording a class for the purpose of ultimately being able to then go back and use whatever value it might have in the future to be able to memorialize that and then go back and somehow be able to capitalize on those things that have been recorded for the benefit of the students in the future. Not really knowing right now, because this is very early days, not knowing right now exactly how you would use it, but is there a benefit in recording classes?
I also would like to jump in and say that there's also the procedural aspect of recording the classes that we have to work through with all the staff members, because Ruby, as you said, it's as simple as clicking the record button for the Zoom meetings, but there is the procedure afterwards of downloading it from the cloud and then posting it on the site. So those are some of the procedures that we will have to work through with the staff members. If that's something that we decide to go through with as a district, as we evolve, that will be part of this process of learning for all of us.
Yeah,
And if I may, Tony, just to build on what you said, if I may, in the spirit of being very black and white, this is a major issue of relationships with our teachers. Live streaming is something we're insisting on. How interactive the live streaming is, or how, dare I say, stagnant it is, those are things we have to work through. We are insisting on it. That is management and board right to take that stand. What you're raising, Ruby, could be then an aspect of that. I think what, I'm assuming black and white, what is going on here, unlike a higher ed community or other instructors who may have had longer work at recording and putting their work out, this would be a big change. And I can assure you this question is pressing in all the districts around us across the state. So I hear what you're asking. I am committed to digging into it, working on it, but to be black and white, it's a pivotal point of relations with our teachers in terms of their art and craft, which typically is within a room without a recording of it or a, but we're going to work on it. I think your questions are good. We're going to work on it. I hope you hear what I'm saying about it's a fundamental relational piece that we need to work through. So I'm picking up a bit on what the chair, Tony, said about some evolution here. We are going to be a very different district in terms of the level of interaction digitally this fall than where we were this spring. That is a big gain. Where I, as superintendent, I have insisted in very simple ways, more instructional time, if we're in any sort of distance learning mode, be it hybrid or not, and more contact time digitally between the teacher and student. And those are big steps forward. We will work on the recording piece, and the board should keep talking about that because that may help the conversations. But I just want to be clear on, if you're feeling a little bit of, dare I say, resistance, it's not that. It's us worrying about managing some relationships that are going to be fundamental to how we operate.
I think the exciting, I honestly think that if there's one thing that has come out of this public health crisis is the ability to really enhance the way we deliver education through, live streaming, potentially saving content that we view as valuable to reuse. I think all of that is all very valuable, but I think this is still a little bit early days, and I think we have to basically take one step at a time. Yeah.
One thing I agree totally, Tony, with what you said, and Dr. McCarthy is correct. We're just not there yet to be able to do that with the teachers.
Right.
Now, that being said, back in the spring, I think one of the most exciting things I heard from the CILs was after 2 or 3 weeks, you kind of have this organic, like, we're going to learn how to do small groups. We're going to do this. We're going to record. And more teachers were feeling more comfortable with the flipped classroom model, especially in math, doing those segments, videotaping them and then putting them on for homework so that when they had the small group experience, whether it be in the classroom or virtually, they could really work one-on-one with students. So you have teachers, finally, they said, the best thing that happened was they had to do it. They had to try it. And then as they're trying it, kind of their anxiety about it goes down. Because, I'll be frank, you're videotaping yourself, you're putting it out there. And as an administrator, then I envision some kids making fun of it and putting it all over Facebook or I don't know on what. And then we have a mess on our hands.
Yeah.
So,
yes, but on the flip side, but on the flip side, I could see a first grader who absolutely loves his teacher, wants to see more of his teacher, absolutely loved the lesson that he went through the day prior, and his asynchronous learning at home is it's boring to him, and he has all this extra time, and guess what? He would love to relive that day at school the day prior.
Yeah,
so I think you're going to have different intentions for these recorded videos for different schools.
Yeah, Ruby, that's a great example. We are not taping lectures. In that case, the entire classroom would have to be filmed to bring in that experience, which we may get there in K through 12 education, but there are a whole set of privacy issues, families having to sign off on the willingness to have their children on a taped recording that could be distributed anywhere. So the spirit of your question is exactly right. But our understanding in education of recording tends to be in a lecture format or a focused spot of a room as opposed to the entire room, that also gets into the digital capacity. So your questions are exactly right, but particularly at the elementary level, the entire room would have to have been filmed with someone almost tracking that teacher, because our teachers, elementary, as you know, because your children, they're not standing up front imparting that knowledge. It's much more interactive. So how we would film that, how we would capture that, I mean, that's an issue. But these are all the right questions to be thinking about. It's just getting there in the immediate time frame will be difficult.
Yeah, Bill, and just to add to that, I think, right now, one of the things that's helpful as we prepare for school is that we are doing mock run-throughs of, delivering a lesson. So from a classroom, having a teacher and a curriculum leader with an administrator, kind of, what does that look like, and how are we streaming, and how does that technology? So we're testing that out now. And I think you're going to see, ways that, and the teachers will find ways to innovate and create as they did last spring, that may leverage some of this content, over time. But yeah, the camera for the live streaming will be focused on what we call a teacher zone, a specific area within the room, and it wouldn't capture the whole place. So if a teacher were to leave that teacher zone, that time when that teacher's there, I would say the quality of streaming would be lessened because the teacher isn't actually on the camera if they move away for some reason. But that's something we are testing out, to try to get ahead of that for when teachers come back for the training and development piece.
So Lisa, just a point of clarification about the high school hybrid program. On the morning that either the blue or gold cohort is at home, there's no specific time that they need to be logged in on class. It's their time to do whatever they need to do as far as the assignments, but there's no specific login time that they have.
Sorry, they have to log in at 11:55.
So then if typically for our athletes, and I'm not trying to dive into Mark's territory, they have attendance requirements. So if you have an athlete who has their morning off, as long as they attend their afternoon classes, they're good to participate.
Yes. It's not going to be the way it used to be, how we can figure out and count. Yeah, it's going to be different. And actually, thank you for bringing that up. I have to add that to my list of things to check on with Mr. Berkowitz.
Other questions for Lisa or Dan? Okay, maybe we can move to the next agenda item then. Athletics reopening. Mark, are you on? Yeah. Maybe, Mark, maybe you can start with the state, kind of start broad at the state level and then kind of move to kind of Weston specific.
Sure. Well, it's been an interesting summer for all of us. I think that includes the world of athletics. The state has continually changed the direction I felt that we were going in. If we had had this meeting maybe on Monday, I probably would have been given a different, I would have thought we were going in a different direction than what they just came out and stated on Wednesday. And now that that statement came out, more information has come out late this afternoon that might be changing things again. But so fortunately, we've had meetings with the heads of CIAC every week this summer, since actually every week starting last spring. And those have been very informational, informative, and helpful. in helping us direct what's going on here locally within our conference and within our school. And we've met as SWC athletic directors. Our conference athletic directors have met weekly throughout the spring and summer as well to try and dissect what we've been given and how to best utilize that at all of the schools across our conference, as well as the conference as a whole. At this point, sports are ready to begin and start on Monday. Just football would start on Monday. All other fall sports would start. That would be football and cheerleading that could start on Monday. All other sports would start August 27th. And we are also in a hybrid mode, so to speak. The first week for football is really just a continuation of the summer. So it's going to be conditioning and cohorts of no more than 15. And that's what they've been doing most of the summer. Anyway, their cohort size was 10 over the summer. So they are allowed to increase a little bit if they so choose, but everything else stays the same. In week 2, they can start introducing some skill specific work and tactic work, still cohorts of 15, still no contact, still social distancing in the practices. And I believe they're allowed to put helmets on at that point, but no shoulder pads or anything like that. So it isn't until the third week, actually, yeah, I think it's the third week that they're allowed to they increase the amount of time that they're together. And then in the fourth week, they're allowed to have the whole team together. So, that's kind of how athletics has taken this hybrid model and used it. We were supposed to start playing games on September 10th. This year, we won't start playing any games in any sport until September 24th, assuming that at that point, Connecticut still has the great numbers that it has right now, and we're still in a good position to move forward. Obviously, transportation is something that's been discussed frequently amongst our groups. And one of the things we've done there is in the SWC, we've taken all of our sub-varsity games. Usually we send a JV team and a varsity team on a bus together to an away game during the middle of the week, and that would be too many athletes on a bus. So we have taken all of our sub-varsity games, freshman and JV competitions, and put them on Saturdays. We have Saturday jamborees going on in different locations by regions. We still did the routes. One thing I forgot to mention with the competitions is our competitions are all broken up regionally. So we are not playing even all of the schools in our own conference. There's a north-south kind of division that we broke up into. We would be part of the South Division. And so the sub-varsity competitions are along those same lines and are going to be taking place on the weekend, so we don't have to send 2 buses to those away activities during the week. So thinking financially as well as room on a bus. We have elected in the conference, and this is really many places in the state from the meeting I was on this morning, are not allowing fans at the games, at the competitions. So we are going to make every effort we possibly can to live stream all of our home competitions. Some are easier than others. I'll bring up cross country as one that's very difficult to live stream. But I'm going to work with our videography department and see if there's a way that we can at least get the beginning and the end of the race, if not some of the middle. So we're going to try, same with swim and dive. Another one's hard to live stream because you're in a pool venue. But again, we're going to work on that to try and have all of our home events live streamed so that the parents can still see their kids play live while it's happening, just not necessarily in person.
Yep. Now, you mentioned football and cheerleading. Like, for example, what's going on with like soccer?
Soccer, both soccers, field hockey, volleyball, and cross country all start on August 27th. Right. They are also starting in a hybrid model, so they will start with cohorts of 15. They're only allowed a 60-minute practice, 30 minutes of conditioning and 30 minutes of skill work for the first week. The second week, they can go to a 90-minute practice, which would be 45 minutes of conditioning, 45 minutes of skill work. And then the third week, they could go live with their full team, but they're still not allowed to scrimmage or have contact in their practices until September 18th, which is a week before the scheduled first game.
Right. Now, just to go to the obvious, right? Which exactly where this discussion is going to go, which is, okay, let's go to what is this discussion like when we talk about having a football game on September 24th, and then you basically have, you turn around and we have a staff meeting with Dr. McCursey, who basically where we're all kind of trying to figure out how to keep our students 6 feet apart with masks, right? Talk me through exactly how we try to create an intellectually honest argument that basically takes us through all of this and gets us all comfortable with this.
Sure. Well, I can tell you that we're not in a football game, not 6 feet apart and not wearing a mask. So that doesn't help to start the argument, but that is factual. We are taking our lead from the CIAC, who has been sitting at the table with all the state medical leaders.
Right.
And the word that we were given is that at this point, it is deemed safe for that activity to happen because of the numbers in Connecticut, because of the fact that we're not traveling out of state, because of the fact that we're keeping things more regionally located instead of traveling all over the state as we normally would during a season. We've been told that participating in these types of events will be safe. I will tell you that we just got an article today from the State Department of Health that came out and stated that they don't recommend that we play football or girls volleyball, which I was a little surprised at volleyball, but that was included with football. The only two high-risk sports that we play in the fall that are, according to the National Federation of High Schools, that are considered high risk would be football and actually cheerleading. And it isn't sideline cheer that's the problem. It's the competitive cheer when they start stunting and doing pyramids and tumbling and those kinds of things that would be considered high risk. But according to the State Department of Health, the article that came out today, they are recommending that football be put off until the spring, if not canceled. We have not heard from the CIAC since that came out. So that's why I said, if we have this conversation tomorrow, things could be different again.
So this is evolving daily.
As Glenn Longarini, who's the head of CAS CIAC, has said every time I've heard him speak, including to us, everything is fluid and it changes from minute to minute. And we just have to be flexible and be ready to move.
Yeah, let me, if I may, Tony, reinforce a bit, because down in this region, you have districts that are great locations of scholar athletes. And so the superintendents I spend 90 minutes with every week, Weston is a great sports town, but you've got New Canaan, Greenwich, Darien, all the rest. So this has been a hot topic. And as of last Friday, we thought, and I'm just going to say it, Mark, we thought the announcement was going to be this week, and that's what Mark's hinting at. There would be no football till the spring. We all thought that was coming. And then it didn't. And now there's a new study out, or at least a report from the Department of Public Health. So this is fluid. This is fluid. And I actually, and this may be one of the hottest topics out there, how we deal with it, because I think you put it very well, Tony. The sense of the intellectual coherence on this one's a tricky one. I think we're, families that are concerned, board members are concerned, this is fluid. And the CIAC, and Glenn's come and sat virtually. He has sat 3 times now in the last 5 weeks with this group of superintendents, so that I just mentioned. So we'll see, but this is one for the board to consider. I mean, the board has full right to say Weston has to do this differently. You have that full right. But the consistency here is a big issue, and that's why you're not seeing a lot of districts. I mean, they're waiting to see what more we'll learn from CIEC. But I would urge the board to
I
push,
think-
probe, and ask these questions.
Yeah, I think it's
because
important- I think it's
go ahead.
important to ask these questions, but I think ultimately, I think over the last several weeks, we've seen movement. I think we've seen a lot of movement among surrounding districts. We're seeing movement in the state. So I don't think it's a matter of the board jumping the gun here. It's a matter of watching and observing this and seeing whether this actually ends up in a place where it all kind of makes sense. I mean, we all want to see athletics actually happen. We just want to make sure that there's consistency in the way we're dealing with the public health advice that we're all getting. And I wouldn't advocate the board jumping the gun here. I would advocate that we actually watch things evolve, because it looks like ultimately things are moving in a direction that seems to be self-consistent, maybe. I don't know.
Well, and the other thing to remember, Tony, is that, again, we are starting Monday. It seems like, oh my God, we have to make a decision. We're starting Monday. But Monday through the whole first week is the athletes are doing what they've been doing all summer. They're cohorts, and they're only doing conditioning and film work and stuff like that. So they're not doing anything different yet anyway. So we do have some time.
That gets me to more of the Weston specific protocols. What do we need to do? I mean, because of the fact that these are athletes, and athletes tend to congregate and they work out and condition together. It's just natural. Like, what are we, from a Weston specific point of view, what kind of protocols, what are the things that you're concerned about? What protocols are we putting in place to make sure that as best we can, we're adhering to the safety, the health and safety protocols that we're trying to apply to everyone?
Yep. On the fall coaches guideline protocols that were sent to you, you can see that we are taking it seriously, that our coaches do understand that they need to social distance. Coaches have to be in masks unless they're physically involved in some way. Any bystander, anyone who's not participating, so if an athlete was injured but was part of the cohort and was still there, they would need to be in a mask. Anyone who's not participating would be in a mask. That equipment is disinfected after each use. That so we're opening up our team rooms and locker rooms only for athletes who are in school that day. So athletes that are home, if they're the gold group and today's a blue day, those athletes will come to practice already dressed, so they don't need to go into a team room. They are to bring their equipment home every day. So if we're talking football, their shoulder pads and helmets will go home with them every day. They're not left in the team room as they were, last fall. The team room is really only for storage. So if an athlete comes in first thing in the morning with their equipment and needs somewhere to put it for the day, they can put it in a locker in the team room. And then once practice starts, all their stuff goes with them to practice. They will not be going back into the team room afterwards. The coaches have been instructed not to give water breaks. So that may sound a little weird, but let me explain. Water will be available. The kids have to bring the athletes will bring their own water bottles, and they need to be marked with their names. We provide water bottles to each athlete at the beginning of the season that they can use throughout the season. There will be jugs of water for them to refill their water bottles only. They will not be allowed to drink out of them. The reason we say no water breaks is we don't want all 15 athletes off at one time congregating around the water jug. So the athletes will be told that anytime they need water, they should stop and go use their water bottle and get water. But they're not going to be given time off to stand around and talk and drink water and socialize.
What about, we talk about football, but what about what's the soccer players? What kind of distancing are they have to adhere to?
It's this exact same protocols when soccer starts on August 27th, and field hockey and volleyball, cross country, swimming. Swimming's a little different because it's inside, but it's still very similar. They are going to be distancing. They're not allowed to have contact. They're not allowed to have scrimmages. They're not allowed to play 3v3 as part of a part of their practice. It has to be individual training, or it can be group training as long as they're social distance. And the same thing with the water breaks, and the same thing with the team rooms and locker rooms. So yeah, I was speaking in general terms about all of our athletes, not just the football players.
Yeah, do we have any post-practice in terms of use of the fields? Let's say if they want to have between themselves a scrimmage or do something, what are we doing in terms of use of the fields after practice?
Well, by the time we are off the fields, with the amount of time we're going to need right now, it's going to be dark.
Okay.
And the lights will be turned off. So I don't foresee that as a problem unless it's a Saturday afternoon or Saturday morning practice or something like that, where it could be possible. But because we have the cohorts are only 15 and we still want to give everyone practice, our practices are going to go a little longer than we're used to. Even though they're only allowed an hour, it's an hour with each cohort. So if you have a group of 45, you're talking about 3 hours instead of an hour and a half to 2 hours of practice for that team.
Are you opening the weight rooms?
Right now, all of the weight equipment that's being used is moved outside. The direction we're given is that weight room facilities can be open if there's enough ventilation and if the equipment is cleaned after each use. That's a conversation that we haven't completely had because I knew that all of the stuff that was being used right now was outside and we were good that way. I'm fine with it staying outside. I think that's safer. I also know that during when school is on, we have a certified person who is in the weight room at all times and will make sure that whoever's in there is social distancing. It's not just it's not always just a team. It can be students from school too. So that makes me feel more comfortable that we do have that person in there overseeing that. So I would be comfortable if it were open, if that's the direction that we end up deciding to go.
Mark, you mentioned the athletes bringing their equipment every day and taking it home every day. When they bring it to school every day, if lockers are not being used, where are they housing this equipment?
That's what the team rooms and locker rooms will be used for. Those
Oh,
lockers
okay,
will be used.
okay.
Our team rooms, we're very fortunate because our team rooms are open through first period every morning, so the athletes can drop equipment off, and then our security officer, when they're walking around, or custodian will lock them up. So that's what they'll do.
I mean, one question I might ask the board is, it's important we were able to post for you yesterday the set of documents that Mark's put together. Those have been worked on all summer, and we actually had brought legal counsel in to help Mark on some of that, just so we're very thorough, because he was very clear and strict. But a takeaway here, and this may help the community, is that this is a real easing back in. Anyone who knows any of these sports well knows that this is really a model of hybrid. This is, and I'm going to say it again, it's an easing back in. It's going slowly. The big question, because where you may end up, is football. The other sports, and as we've said, cheerleading. The other sports you can still do and have some sense of the social distancing, not the masks. I mean, you can see what's happening internationally in some of the sports. But football is the big question. But this is not back to normal like that. This is the easing in, going slowly, setting dates further out, limiting travel if that even happens, so that so this is not normal. And again, being very cautious, it may help the community to have, and it's now a publicly posted set of documents, but it may help the community understand that this is an easing in. This is just not business as usual in the athletics realm at all. And it's fluid. We're gonna, I think, my hunch is see some changes in the next several days. I could be wrong, but that's my hunch.
And one of the things I forgot to mention real quick is as far as protocols go, Tony, was the checklist, the check-in list that we have at the last page of the guideline document, which is really important, that every athlete will be checked in before every practice, and they're stating that they don't have a temperature, they don't have a cold, they feel well, they haven't had any stomach issue, you know, all those kinds of things that we've been talking about. Sorry, I didn't mean to cut you off.
No.
Sorry. Quick question. Weston, right now, the policy is that if you are a distance learner, you are not able to participate in athletics. Are the schools that we are competing against or we're in competition with, do they have that same policy, or are they allowing their distance learners to participate in athletics?
Some do and some don't. It's actually a conversation that I'm going to be a part of with the principals in the Southwest Conference tomorrow morning to discuss that. Some principals want it to be a league-wide decision. And in the conversation, I can tell you about the conversation the athletic directors have had. We decided and discussed that it didn't need to be league-wide because it didn't really impact competition. So if Joel Barlow decided to allow their distance learners, which by the way, they're not, right now they're not allowing their distance learners to participate. But if they did, and we didn't, it really doesn't impact what's going on the fields of competition right now. So we were okay if that was slightly different. There's logic obviously behind both arguments, whether to or whether not to. I feel more comfortable having, if we have students that aren't coming to school by choice, then to keep them as safe as we're trying to keep them by not allowing them to come to school, it's hard for me to justify letting them run around on a soccer field or a field hockey field with students who have been in school all day and had contact with the other 300 to 400 students who were in school that day. So that's where the justification part came for Lisa and I when we were discussing it. And we bounced this around quite a bit before we brought what we thought our decision was to Bill, and had a conversation with him, and went through a lot of the same conversations.
Yeah, this has been a big, if I may, this is important I say a few things here, because this has been a big topic at the superintendent level. It's intriguing me in SWC, it's sitting at the principal level. I think there may be some questions that it needs to go up the ladder. Again, the voluntary distance learning program, as we're calling it, that was established to give families who don't feel comfortable being within the school setting physically, to give them that option. I think there's a sense amongst a lot of people that then let's be consistent, and that means for any of the programming. So then for athletics to say, okay, I'm going to come in just for that, but I'm fundamentally wanting that freedom to not be in for the rest of it. Again, the state established that program to allow a separate physically separate opportunity for students. Again, I think one thing I'm going to be chatting with my fellow supers tomorrow about is where are you on this? I think most are more where Mark, Lisa, and I are. We are unified on this. We know there's some families that don't agree, but it's a way to be very consistent for this, what the voluntary distance learning opportunity is, and it helps us better manage the interactions, because as you've heard from Mark Cooper and Laura Marks, we have to be able to understand the interactions to keep a handle on this in terms of COVID issues.
I actually understand I absolutely understand the rationale for doing that. But maybe let me give you another point of view, right? Which is, we basically are saying there's fluidity between a student, a family opting in and out of hybrid versus voluntary distance learning. Now, I could see the argument if you basically have a student going in from a quote unquote high risk situation to a lower risk situation, and potentially infecting or potentially subjecting another cohort to higher risk. here you have a situation where you have a choice of someone going from a lower risk situation to a higher risk situation, which is a choice, right? So I can see both arguments basically saying if you're creating fluidity around families being able to move from a voluntary distance learning to a hybrid, wouldn't you also include this in that overall choice? But I could see the argument both ways, because I understand why would someone who basically chooses a voluntary distance learning want to actually subject themselves to a situation where it's much higher risk. So, I could see it both ways, but if we're actually allowing choice, you might want to consider that as well. I don't know. But I can, I can certainly appreciate the position that you're stating now. Absolutely. But I think there's probably a different point of view as well.
Sure.
Yeah,
Yeah, just real quickly. So this position is also consistent with the policies we followed in every other year. I know this is far from a normal year, but in any other year, if a student was not in school when school was going on and they were supposed to be in school, they're not allowed to participate in athletics.
I get it.
So we're just trying to stay somewhat consistent with that, even in an inconsistent time.
Yeah, yeah.
I also think that because I have gone, as Mark knows, I went in the office a few days ago. I said, I am struggling with this because I'm, these are the things that keep me up at night. You want to provide access for students. You also want to respect families' points of view about why they want to participate in the voluntary distance learning. What and we're not going to make everybody happy. It's one of those things we may agree to disagree in the end. I do think that we are making the right choice. What I have found though is I'm always saying, pick up the phone and call. And if you have a question, I'm happy to speak to you. And in speaking with, I don't know, I've probably spoken about 10 families now, and not only just about athletics. And you'll ask, like, what is your biggest concern? What is your biggest fear? And you're trying to paint a picture for them of, okay, if they're in the building, this is how it's going to look. I'm looking at the kids' schedule, I'm not disclosing anything, but trying to say, this is how this will happen, that. And I just think that's really important, because in some cases I've had, I hear the somebody in the background, the kid in the background say, see, Mom, I want to come in the morning and I want to play. And then I have others where, that's a family decision and I respect that. But I guess my message to anyone is if you're not sure about it, if you're struggling with this choice, pick up the phone and call us, because one-on-one, I'm more than happy to talk through it, and it might allay some of your fears. It might not, but understanding, when I was talking about, okay, they'll be on the soccer field, pushing into each other without masks, sweating, playing against kids from other schools. You just need to know that, and then some, whether you're fine or not, but they need to really look at what the details are of both scenarios, I think, before they make a decision, because you don't know what you don't know, kind of thing.
Right. I think that's very wise. I think that's right.
Could I ask, because we've talked about the flexibility and fluidity of flipping back and forth between distance learning or not. I read another district saying that they wanted like a 3-week sort of lead time. I don't know where we stand on that, but how does that relate to this policy if and when they would transition?
Yeah, Victor, it's a really good question. We've set out we want a 1-week turnaround. That's similar to some districts. 3 weeks is a little extreme. I don't want to step on the toes of probably a colleague by what I just said, but I think we wanted about 5 days. And intellectually, you raise a very good point here. If a student can come and go, and there's some major activity, and it could be something in the extracurricular other than athletics, if you don't get in at the start, but for whatever reason you shift in because that's what's best for you and your family, you know, by not starting, you've lost that chance. But I think where we are on this is, while it's fluid, you can't be in both places. You either are voluntary distance learning or you're in the hybrid. And if we open up, you know, for these sort of, you can say, okay, you let me in for athletics, why can't I come into the building for the AP? Or why can't I come in, you know, I think that's where more districts than not. So I'm a little surprised by the SCWC principals, frankly. I know where ours is.
It's only a couple of principles.
Yeah, I know where ours is, because that to me is the consistency issue. And you heard me say last night, families, if you want some in school and you're nervous about all in school, that's why we're doing a hybrid. It's all driven by public health.
Yep.
You know, but if you don't feel comfortable coming in right now, that's why the state mandated that we all have the voluntary distance learning. But final comment, I think the place I settle on, and I think where Mark and Lisa and I settle on, is that you choose voluntary distance learning. We honor that. We respect that. We got to make it as strong as possible, but that you are not physically in the district while you've made that choice.
Yep.
And that would cross-cut anything we offer.
And also, Victor, this is just, you know, if you opt to distance learning in the fall and miss out on fall athletics, and then decide, you know, in November you want to start coming to school, when we get into the winter season, they'll have the opportunity to participate, knock on wood, hopefully we have a winter season, they'll be able to participate in the winter season at that point.
Yeah.
There's one other thing I want to add, not related to sports, Victor, but the idea of how fluid people can move back and forth. One thing that hasn't really been mentioned, but it will be, you know, it can happen, is you have someone that is participating in the in-person, and then the person gets sick, and the person is out, not maybe for COVID, but for something, gets the flu, something like that. You know, we can't wait 3 weeks as if another district, that timeline is way too long, because the person might temporarily need to access virtually while he or she is sick for a week, 10 days, things like that. So that's why we, you know, give ourselves lead time to be able to transition within a reasonable amount of time. But that also is going to happen. I know it is. Kids get sick, and then especially at my level, because they're older, I can see them just contacting the teacher directly and saying, "Hi, I'm coming in now virtually because I'm homesick for whatever reason. I had my wisdom teeth out. I don't know," things like that. But that's important to know too, that those kinds of situations will happen naturally.
And we do in the document say 5 days. I just double checked. It's a 5-day. But what's important in some of the questions we had, if you need to be out on 14-day quarantine, or you need to be out, you then move into the voluntary distance learning, which, as you heard last night, is a reason why, well, we don't have the staff to do separate voluntary distance learning classes, but we want to blend, because if there may be this back and forth, and tied to a cohort and tied to a class, because we can most easily manage that from a staffing standpoint and then a student experience standpoint.
And just like in a normal year, if a student is homesick or had their wisdom teeth pulled and was home on a day they were supposed to be in, they wouldn't be able to participate in athletics as well.
Any other questions for Mark? Sounds like this is an ever-evolving topic. It's probably not the last conversation we're going to have on it.
I'm sure not. I appreciate the time.
Yeah, and Tony, I would ask the board, maybe not now, but to reflect on the documents Mark put together, the conversation here. I hope the takeaway, and there's a communication issue here, but we've got three very solid documents in a package now, thanks to Mark's good work, that's very thoughtful. And again, the simple takeaway is this will not be business as usual. This is an easing back in. This is a conservative, cautious approach to, can there be athletics here in what I'd say is a scholar athlete town? Can we have that and in a healthy way, and go very slowly, very carefully, with lots of chances to pivot on a dime and say we tried, but we can't. but board, you think on whether in our attempts to communicate much more actively, if this is something we should be sharing beyond what's posted for you.
I think it would be helpful for the documents that are posted in CAVE get circulated to all the high school athletes. Not everybody lives on CAVE.
Yeah, we're trying to get them posted on the athletic website as well. I've had a little problem with the new website and figuring out how to get it where I want it. So it's going to be taken care of hopefully by the end of this week.
And there's someone named Dan DeVito on this call who can make sure, one, he helps you, and two,
Yeah, I've been trying not to bother.
I think within, maybe by the time I finish this sentence, Dan DeVito will have posted this on the COVID-19 resources webpage, and with a special button, maybe. Hint?
Picking up what you're putting down, Bill.
Okay.
And I've been trying not to bother Dan to get that onto the athletic part of the website, but I may need to at some point if I can't figure it out myself.
I will say the athletics, the attachment for this meeting is already under the communication section of the COVID-19 website, but I will put a separate one for athletics and post it there.
Thank you, sir.
Bill, just following up on just that communications point, there's been a lot of stuff added to the COVID page. And I just think maybe blasting out a link to that COVID page to our families, because I just don't think that many people are accessing it.
Yeah, no, Gina, very well said. And on my list today, tomorrow, and that's going to be tomorrow, is the next update, which 3 sentences. It's on the COVID-19 page. That's where you go for everything, and just start driving people to the page in all ways we can. Today, the energy became, and thank you, Dan DeVito, thank you, Meredith Herman, for putting together our way to deal with the excellent questions we're getting and a system for that. That became first order today. But we're going to do, we have that plan as you're suggesting, Gina.
Mark brought up a good point when he was talking about taking equipment home every day. I don't know if we've discussed this from a district-wide perspective, but are we requiring teachers to take their laptops, cameras, and iPads home every day? God forbid we were to get into another distance learning scenario and need to, without notice, stay home. So what are we asking the teachers to do with their equipment?
I can jump in and say that the equipment we will be asking them to take it home. That way we're flexible, that if we have to make a change on a moment's notice. That's why, we went with the iPad. It's very portable, and the document camera that we are providing for everybody, it can fit in your pocket. So we ordered that stuff with changing on a dime in mind.
Awesome, thank you.
Okay, that brings us to the next agenda item, which is discussion and potential vote on superintendent's recommendation for fall
Tony,
2020.
Tony, if I may, you may want to give Tracy a chance. I mean, the gen ed area with SPED is so vital and critical.
Sure.
It may be worth a little brief update, and I think, Tracy, you're primed to do that, correct?
Okay, absolutely.
I think that's really important. If you don't mind me interrupting.
Yeah, no, great. Sorry about that. I had that on my list, but
sorry.
just sped through it. Okay.
I will try to be as concise as possible. I do want to provide just some repeat information in case there are different families online tonight than last night. We've talked about the theme of topics being ever evolving, and special education is another, I think, perfect example of that. As most of you know, we received guidance that we had been waiting for from the state. We received that yesterday, late afternoon. And the guidance is significant and presents with a variety of implementation challenges for every district, including ours. And I just want to be transparent about that there are some things that we absolutely were planning for before we received the guidance, and that will continue to be in effect. But there are also some pretty significant differences that are going to result in us needing to change course. I just want to step you through again some of the things that have been a foundation of our decision making. And I'll also give you an update that no one's heard yet on the board about the work that happened today and the work that's coming next. I am mindful. I said this last night, I'll say it again tonight. I know families want very specific guidance. I mentioned that every single IEP in our district is unique. So every single family has very specific questions about exactly what IEP implementation will look like. I completely understand those questions, and we're working really hard to get information to families in a timely manner. It's just incredibly complex. And now we have a series of shifts that need to happen in mid-August, and that's just the reality of where we are at this moment. A couple of things are going to remain the same. And so if you go back to our very initial reopening plan that went to the state at the end of July, our special education students are general education students first. Every schedule update that you're hearing, every school policy and procedure update that you're hearing applies to our special education students as well. This means that a majority of the students who have IEPs are following the schedules that have been outlined for the hybrid and the voluntary distance learning plans. That means they're part of a blue cohort or a gold cohort. They come to school every other day. There's follow-up work that happens on what we're referring to as the off days. A shift that's going to be happening here based on the new guidance is we might need to be providing services to students on their off days, which was not part of our initial planning. And I'll talk about why that might need to happen when I talk a little bit about the new plan. We have also from the very beginning, from July, talked about the need to break cohort. Not all the time, and in a very planful way, but there are services that happen outside of the classroom for our special education students that have to happen outside of the classroom. That's the best model for those students, and we want to preserve that. So if you go back to the initial reopening plan, there's specific, I'll call it health and safety parameters about how students are going to switch out of their cohort into a small group. There's some extra procedures around that. And also for staff as well who are working within multiple cohorts. I've received a fair amount of questions about pullout. Families think that we're not doing pullout instruction anymore, and that's just not accurate. We are absolutely continuing to do that. And that's true even with the new guidance. We've also talked about from the very beginning, a very select subset of our special education population coming to school every day. There's a need for that. Even within the new plan that we have, there are students who have programming across all domains: academic programming, behavioral programs, social emotional programming, social skills program, activities of daily living. They require ongoing and continuous instruction, and they'll be coming into school each day. That's consistent with the new guidance. We've talked a lot in the last few months about continued education opportunity plans. Those were the plans where we were providing IEPs to the greatest extent possible. That's the language that was used previously, while we were all in remote learning. That plan doesn't exist anymore. And so there's a new model and a new template that we got yesterday that we're being expected to craft in order to document not changes in service times, because that's not going to be an option within this plan. The only sort of flexibility we have is how services are implemented, meaning that what might be written on an IEP as, in person, in a small group, in the general education classroom might need to shift to remote instruction because of, the parameters of our hybrid or voluntary distance learning schedule. I think we have so much practice now with full distance learning, and obviously full reopening is what we had pandemic, I think a lot of the work has happened around the hybrid model and the voluntary distance learning model. Again, the big shift there being we were looking through the lens of to the greatest extent possible, which is no longer an option. So now we're thinking about how are students who are in school in person on either a blue or a gold day for a half day, still getting access to all of the supports and services that are documented within the IEP. The same is true for students who are participating in voluntary distance learning. So the obvious there, if you're participating in voluntary distance learning, you're not getting in-person instruction, but the expectation is that all of the supports and services that are documented in that IEP are happening within that voluntary distance learning model. I can't emphasize enough how big of a shift that is. And it's not just a big shift in what we were anticipating in Weston, it's a big shift for every director I've spoken to. We really thought that there was going to be, some flexibility in those service times, and that's not the case. One thing that we've been talking about and is consistent with the new guidance is that our evaluations, and this applies even for voluntary distance learning students. So when we're talking about special education reevaluations or initial evaluations, those have to be done in person. There might be some things that we can do remotely, but the way that evaluations are normed is that they're valid under certain very specific conditions. And that's not accessing an evaluation through the computer. So one of the other things that we're going to need to be planning around, which we've already started to do and have actually had some practice with our birth to 3 students who we've needed to evaluate in August in order to get IEPs set for the first day of school, is, of course, for our students who are in school, even if it's every other day, we have access to them for evals. But we will need to be communicating with families in voluntary distance learning about coming into the school for those evaluations or a specific process that we're going to follow. And then if families say, we can't participate in evaluations right now, we'll have to wait until that student is available to us in person. We talked about the continued education opportunity plan not being a document that we're using anymore. The new document is called the Learning Model IEP Implementation Plan. Again, that's not describing a different amount of services, it's describing a difference in service delivery. So I think it's somewhat obvious that if you only have children coming to school every other day for a half day, some of their services that are traditionally done in person are going to be done remotely. We'll use that plan to document those changes. This plan, the only similarity really with the continued education opportunity plan is that it's not a PPT discussion. There's absolutely communication that happens with families, but it's not like we need to convene a PPT for every single child in district in order to be able to move forward with these. Another thing I'm getting questions about is the difference between homebound hospitalized instruction, which is medically necessary for a child, and we get very specific medical documentation, versus homeschooling, which is when a family actually disenrolls a child from the public schools and is responsible for their education, including special education and related service. So if you're homeschooling, the child is not participating in public education for IEP services. And voluntary distance learning, where of course the child is still enrolled in our schools, and thus we're still providing services, although again, on a remote basis. All of the special education timelines go back into effect. Most of them, many of them were paused in the spring. That's going to result in a significant number of meetings for staff, especially at the beginning of the year. So I just think that's something that needs to be on our radar. And then those timelines will continue to be in effect throughout the year. We're still being asked to consider services in the least restrictive environment. So providing students with opportunities to the greatest extent possible to be with their general education peers when that's appropriate. There's also a lot of language in the plan that we got yesterday about transition planning for students, which I'm not going to get into here, and our district responsibilities for out of district placements. There's a lot, it's 11 pages. There's a lot of updates, and it is on our website or on the COVID resources website. Today, in light of that guidance yesterday, I had an opportunity to meet with all of our building leaders, and of course our assistant directors were involved in this process, and we stepped through what I think are the most relevant sections of the document for building leaders on a more detailed level than what I just did for you, so that we can begin conceptualizing the work that's going to happen around these individualized plans and mapping out schedules for students, which again, all have to happen in conjunction with the building schedules within the different models. And then I am working on, I was hoping to get it out today, and that's not going to happen, but the next step is communicating all of the details of this plan to our special education team members, teachers, related service providers. They're going to have questions about this document, and rightfully so. So we're going to be structuring some voluntary opportunities for teachers to get more information before their official return, and also hopefully providing some time for our team leaders to be digging into this more deeply. Again, also before the start of school, there's details that have to be worked out with that plan, but that's all in the works in this moment. There's a lot to it. So I just want you all to know that we are absolutely working on it. And again, I understand the desire for all of our families to have really specific information. And I'll be sharing that out as we craft that information in the coming weeks.
Thank you, Tracy, for the update. What is it, like week 3 now? And you know it like the back of your hand?
It's actually been exactly a month today. I noticed it's the 13th. So
I have a quick question. It's great that all of the services are going to be able to be pushed in the allotted time slot of the in-person hybrid learning, but understanding that that's such a finite time, especially per school. Will we need additional staff just to make sure all the services are being provided during that finite time?
So that's the key new piece around the complexity of scheduling.
Okay.
For most students, we are not going to be able to provide all those services in that allotted time. There are definitely some students, we have some students who have support a couple of times a week for a half an hour. Yes, those won't require changes, but there are going to be many students that we're going to need to be thinking about how do we accomplish all of those services, which will require utilizing their off day or potentially the afternoons, which is the remote learning time. Again, when we can do it within the regular school day in whatever model we're in, that's the goal. But I can tell you that there are many students that is not feasible for. And that's a huge shift for us because what the plan has been up to this point is aligning those services with the students' programs and school schedules, because that's what we have done in every format of instruction I think we've all ever experienced. But without that language of to the greatest extent possible around service times, that's not an option. And I'm going to be honest and transparent from the get-go. We might be having conversations with some families that I understand the state guidance, and that's absolutely what we're working toward, but we might have some limitations with some scattered service times being really hard to capture. and having to do it in a very different way or in a more modified way than maybe the state plan is anticipating we're going to need to do. So that's the key distinction. Originally, we were scheduling all services on their select days. Now we're looking at what are the IEP services, and then going back and saying, how do we manage those within the schedule? And then how do we communicate with families what services have to happen differently? If you have push in as a student, if you have push in math instruction, meaning your special ed teacher is going into the math classroom daily. We have children who have that support. Well, you're not coming to school daily. So the days that you're coming into school, sure, we're going to work to provide that push in support, but now we're having to craft some sort of alternative for those opposing days. That's not going to be in class, but it might be a remote version. It might be a small group pullout version. But something to account for those minutes and hours in that content area. And we're going through this process for every single child, because it's not like I can say we have this group of students who have, this kind of IEP, and 20 students have IEPA. There's no such thing. Every single plan has nuances to it. So that's where we are.
Thank you.
Hi, Tracy. You may not know this, but just like in the general population, there's a 80-20 of voluntary distance learning versus not. Do you know how that split may play out in the SPED population?
Yeah, we're monitoring that. I don't have a great sense yet. I think the emails that I've seen up to this point, I think a lot of families are struggling with the concept of, do I have my child participate in voluntary distance learning, or do I have them go in person if they have an IEP, because they don't have a solid understanding of exactly how the services are going to be implemented. I definitely know that there are several special education families who have already made the decision about voluntary distance learning. And again, even within that, there's a significant amount of variation in terms of what those individual students' needs are. I do expect, and this is just a guess, but given that the guidance is that we're implementing the amount of time in any of the models, I think there are going to be families who probably now feel a little bit more comfortable going with a voluntary distance learning model. I think there were families who felt like voluntary distance learning was going to be synonymous with distance learning, and they were concerned that to the greatest extent possible would result in a significant amount of reduced services. And that's not what the guidance is directing us to do at this point. And one other thing I'll just throw in, because this is a significant shift and because there are so many layers of challenge, not just from a scheduling standpoint, but from a student planning standpoint, it's possible that we could have guidance that evolves between now and the start of school, but I'm speaking to what came out about 24 hours ago. I think there are families who are going to say, well, if my child is getting the same services, even if it's going to be happening in a different format, I feel more comfortable going with that plan. That's just based on what the families I've communicated with, and I have more to communicate with.
Thank you.
Any other questions for Tracy? Thank you. Thanks for the update. I just like with Mark, I'm sure there's more to come.
Yeah.
Bill, go to the sixth agenda item.
Yeah, the plan in these two meetings was to provide the board full and robust opportunity to hear what the recommendation is, talk with many members of the leadership team, As Tony had mentioned at the outset, all superintendents are bringing to their boards these discussions. I think there's been a very rich one. It will continue in many ways next week through the some sort of public forums. I know for the board, those are things to talk about from a staff standpoint. We're looking at some things. But I think the board either has to decide, does it actually vote on the reopening? Does it have a consensus discussion on that? It's getting handled in varied ways around us. This week, many of our area districts were having these exact type of conversations. Some boards voted, some did a consensus. As you can see, and Norm, you I think put it very well, a lot here, a lot planned, but unlike anything any of us have seen in our careers in education, and you have quite a veteran group here. Now we're sitting here on the 13th and still a lot to figure out. And some families are confused by that. We understand that. But that's the nature of where we are, the nature of things.
Mhm.
A statement of commitment from the board to the recommendation of a hybrid early release opening would be incredibly valuable to us as a leadership team to clarify that we just keep focusing on that. Our commitment would be to be looking at with metrics and all the rest, what's possible as we move into early October. Update, some have said, some districts set an October 9 date to look at that, but many districts saying, you know, do you modify your opening approach of phasing in a conservative approach to quote Mark Cooper? And we'd stay in lots of conversations and also in that say, is there a way to open up fully viably? And I think, again, a key metric there is, are we able to operate with quite narrow social distancing? Are the health indicators in Connecticut such that we could do that? And by then know how well our students and staff do with the wearing of masks, the hand washing, because you did hear from Mark Cooper. I mean, I think it was really helpful tonight, both Mark and Laura, that if you went to a smaller metric on social distancing, you just got to make sure the other behaviors are truly consistent behaviors, the masking, the hand washing, families making sure they're not sending the children to school not feeling well. We would have some time to figure that out over the next several weeks. So our recommendation stands. We would hope the board in some way would endorse that, knowing full well we're still figuring things out, and we'll be in a lot of conversation with you.
Yeah, I think, you know, I think, Bill, and I want to hear from all the board members on this. I think right now we have a very clear approach, right? Our approach is going from one mode of hybrid to another and potentially to full, where the public health and safety indicators are going to guide us to how we go from one phase to another. There's a lot of details to be filled in under that. We also have an approach for voluntary distance learning, where again, there's details to be filled in under that. I think that from a board, my view from a board perspective, the most important thing is going to be how we fulfill our oversight responsibilities as it relates to the execution of this, which I think is going to be tricky. And I think that's first and foremost. So at this point, you know, my view is that, first of all, we don't need to vote, right? As you know, as the governor and the commissioner of education has stated. And I think at this point, I would basically say, is there a consensus that this approach is one that we should continue on, and then make sure that we set up we set up a process, whether it's task force or something similar to that, to make sure that we continue keeping a close eye on the execution of the strategy. But I'd like to hear from the other board members of how they want to proceed at this point.
I agree with you, Tony. And I think Melissa Walker said this a few times throughout the meetings, and she hit the nail on the head in terms of we need to take subjectivity out of this 1000%. This is purely an objective consensus based on a lot of what Mr. Cooper and Dr. Marks said today. And My only question though, and it's come up a couple of times, is do we need to follow the path of hybrid early dismissal and then hybrid full and then full reopen? Or could we go from hybrid early dismissal to full reopen?
And I can give a very clear answer. We could do that step. Again, I think it's pretty fundamental on the set of the metrics that really are, I think, objective, not subjective. I mean, I think to me it's objective because to go to the full, again, I think it just bears repeating. It's, can we be healthy with very narrow social distancing, which means, and this, so if we're talking early October, by then we're confident that with very narrow social distancing, masks are comfortably worn all the time. Mask breaks are understood. Hand washing is consistent. Families are checked. It's all what's in that Weston commitment, shared commitment to health and well-being. And is the district doing what it has to do in terms of cleaning, taking care of the facilities, our staff feeling that they're in the right place to have everybody back in? Those are all the things we can look at. But there's no reason, Ruby, that if we're understanding it, we couldn't make that full in shift. But again, it's, I will be, and there are going to be some who may not be happy with this, but I am going to be, as Mark Cooper said, I'm going to be conservative on this because we have enough objective information around the country as schools have opened, bringing back into groups, young people, you're starting to see that it's a problem unless you do it very cautiously and carefully and being really rigorous on all of those health measures. But there's no reason we couldn't make that step that you're asking.
Dina?
Yeah, I think that, you know, there's obviously been a tremendous amount of work and thought put into this plan, and I have trust in our administrators that this is the most effective way for us to move forward at this time. I will say, though, I think there's still unease and questions amongst our parents about what the students are going to be doing when their cohort is at home. I think there's still, they don't understand the challenges about the, not just like a teacher teaching 5 days and either you're in the class or you're watching at home. I think there's still unease about that. And I think that there's still going to be pressures from families. I don't think they're going to be happy with their student having that morning at home when their cohort's not at school.
Mm-hmm.
Yeah, if I may, Gina, and Lisa, in our leadership team meeting today, we talked about putting more meat on the bones. And some people out there would say, why have you only brought us outlines? Anyone in our seats would be bringing outlines. All you had to do is listen to Tracy today on, for such a high percentage of our students, literally game-changing guidance when we think we had a plan. So, you know, that's where, and all of you have led complex organizations, lean plans sometimes let you be most flexible. So that's that. But let me be really clear. The principals are committed between now and early next week, putting more meat on the outlines for that hybrid early release. I know the high school's already done some of this. The other principals are going to be there. And just so you know, that's one reason we put in process that question and answer system today. Because I said to the principals, I need you working on things that affect an entire building and help families from an entire building understand. And yes, the one-by-one questions are important, but literally we could just, your team could spend the rest of the next several days on, they're very good questions, but the one-by-ones. So that's one reason we did that today, to say, let's get that systematic, because principals, I need you to begin fleshing out a bit more. And I'm a parent in this situation. I understand how uneasy this is, even with great explanation. And Tony Jones in Greenwich is doing a great job. By the way, she has a full communication team, a full HR team, you know, but she, I mean, and even there are hundreds upon hundreds of questions. So we'll keep, but I just hope, I want to make that point. I mean, really clearly, the principals are committed to giving more information, knowing it probably still won't be enough, but it'll be more than we have today. And more than, so I hope that's helpful.
Yeah, I think that's key. You know, it's because no one really can visualize what a new school day is going to look like. Everyone understands what the old notion of a school day is, but you know, it's the unknown really. And
Yeah,
so
I agree. And like I say, I have full trust that you guys have put the best plan forward. As the representative of the parents, I just had to say there is that unease and there's still that open question, but I greatly appreciate the effort and my kids will be there.
No, we hear you. We take your comments exactly right. Well said, and we understand.
other board members?
I'll repeat what I said yesterday in terms of we have to on both sides of the coin, we have to make decisions with imperfect information, right? So it'll be a balancing act. I think that what I've learned is that there is a certain glide path to all of this. So I think Melissa's right that at some point we need to have the North Star on having that metric that will be automatic. That being said, in the very short term, I do very much appreciate the learning curve that everybody has to go through. So I think there's a bridge to get to that more systematic metric. And I think that's what we're doing. And as long as we balance giving everybody enough time to adapt and working towards that systematic metric is the balance that I think we need to strive for.
Anyone else?
I mean, I agree with what everyone said. It's a hard situation because education is essential, and we have all these, you know, factors that just are huge challenges. So, I mean, the only thing I'm thinking is that can we have some sort of weekly check-in that we can take the temperature of how things are going, so we're not waiting for our monthly meeting?
I think that's going to be essential, and you know, my recommendation was to sort of use the task force or some form of the task force to be that weekly check-in, so that, you know, so that we can actually, you know, monitor the execution. We can actually, like Victor says, is look at, you know, have those conversations in the check-in to determine where we are in that glide path, whether we're falling from a public health perspective or going backwards or forwards. I think we can't rely solely on committee meetings. We can't rely on the monthly meetings because those are too far apart. I think we need to continue the task force in a different form in order to, I think, discharge our oversight responsibilities as we go through the execution of this, right? And so I agree with you. I think it has to be some regular weekly updates.
I think for us to have an extremely successful hybrid model, which I think we can, I think there has to just be accountability on all fronts. And I know we've said it over the past 2 days, but I'm just going to echo that same sentiment. And it has to be accountability from the students, accountability from the parents, to the teachers, to the principals, up to administration, to do what we need to do to make this a really successful fall. And I encourage the principals, if you haven't already shared the data from the survey, we have really rich data from that survey in terms of how you know, that particular cohort performed in the spring and what the parents thought and what they thought about the level of classwork, the level of homework. Share it with the teachers so that we know what we need to do going into fall. And I agree with Gina wholeheartedly. I think there's a lot of angst on what's going to happen on these off days. And it wasn't clearly defined here. And so I think all parents are kind of looking forward to that over the next couple of weeks. And sorry, one other thing, Laura, I sent you an email about this earlier. I do think, if possible, to any new family that is new to Weston and new to the WPS district, I think they need to almost be handled separately, especially the incoming kindergartners. I think we need to give them a little bit more, attention, just in terms of making them feel comfortable of entering into our district for the first time.
Ruby, that's an excellent point. It came up in the leadership team today because yes, it's our kindergartners, but we've got across the district as many as 75, 80 new students. And I worry about that. I mean, I've worked in this district long enough to know, starting my 5th year, that most families and children are with us, just any one child, for about a 10-year run. So I'm starting to get enough time here to get that feeling. And it's one thing to be in your 4th, 5th year, knowing the system, and now it's something new. It's one thing to be here brand new. And wow, what is this? So your point is so well taken for the kindergartners. And to the principal's credit, they brought it up today to say, any of our new students, we got to do a little bit more than we've done before. So
Yeah.
I just wanted to underscore that.
So it does sound like there's a consensus to march on with this approach. I think, Bill, we have to probably speak about, how we organize ourselves in order to have, whether the task force gets reconfigured in a way where we can actually have those weekly check-ins in terms of making sure that we kind of are on top of the, from a board's perspective, that we've discharged our supervisory responsibilities with respect to execution of the strategy we're going to take for reopening. It sounds like there's a consensus here to continue with this approach. I think one of the critical items coming up is going to be making sure that parents and staff are ready for the opening so that we can make it as successful as possible, which leads me to next week, and how we want to organize a public forum to be able to really dig in on some of the outstanding questions that parents have. Obviously, things are evolving. We won't have answers to everything, but I think this is an extremely important next step for us. I think there are many parents who are starving for more, and to the extent that we can give them more, we should have this public forum. And the question is really, how do we want to organize it to be as effective as possible? So, Dan, one of the things that we discussed last night is whether there's an ability for participation through, not asking questions, but somehow, sending questions through some form, whether it's, typing questions out or whatever live, so that we can handle a number of questions as they come up live.
So we had created, and we actually sent out an email to families today with a link to a Google form where they would input their information and then they would put in their question. And so we can use that as our live feed for any questions that can be asked from now until the meeting. And then if we choose, we can keep, the form submissions can stay open during the meeting and someone can look at the submissions, because when you fill out a Google form, it puts everything into a Google sheet. So it's updated automatically in real time. So if people ask questions, it'll pop up on the sheet and we can bring it forward live during the meeting if you'd like.
How about the questions that people have submitted through? I mean, everybody has gotten a bunch of emails. How about the ones that have, been submitted so far? How do we handle those?
Dan, you want me to speak to that?
Sure.
Yeah, I mean, the communication went out to families and staff did have a statement in there. And I said to both Dan and Meredith, put my name on this and I'll deal with the flack. But we did say to families, it would be helpful if you resubmit, because right now, if my emails box is probably like yours. Again, I thank people for sending the questions in, because also, as I said to the principals today, I don't want you going one by one through the questions, but I want you those as data to figure out how to flesh out the outline. And I think it's really important. I'm doing this deployment move with the principals in terms of, because I think we'll get to a better place when they're doing that, but use the questions as data. So the questions are data. It's really helpful. It's just now, how do we manage it in responses? So families say, hey, I wrote in, I heard something back. So what we want to do is, if families could, is resubmit, just cut and paste, send them in, because then we systematically, if you heard what Dan DeVito just said, we get them all in one place. It's much more easily much easier for us to organize them, deal with them, and thus be responsive. And so I'm hoping to begin seeing that as they are there already, and begin to fill out more, give some answers. And the place we'll put them is the FAQ. They're so similar, which is great. I don't think the FAQ would get overwhelmed, but we may have to think about how we organize that. And Mr. DeVito is so smart on this, I think we'll have a solution. So that's a long answer, but an important one, Tony, to your question of all that's come in. How do we deal with that? I do like Dan DeVito's suggestion about between now and the meeting, or your forum, because we can say, forum, please have your questions come in. The open question yet would be, how do you actually want to handle the meeting? Do you want to, in a sense, have like the Board of Finance did, where you moderate it, people can actually speak and raise questions? We're going to have many more people involved. So my recommendation would be, this is real-time questioning. You know, by the way, Dan DeVito just explained it. I think that allows you all to be efficient in answering what you can. It allows not me, but the team you've heard from be efficient in answering questions. So that would be, if you heard Dan DeVito's recommendation, I think that would be the way to go.
If I understand this, there'll be a communication that will go out, let's say tomorrow, about public forum. We'll give it X amount of time. I don't know, 2 hours, whatever it is, on whatever time we need. On Tuesday, let's say Tuesday evening, between now and Tuesday evening, there'll be a series of questions that'll come in. They'll be grouped and maybe sorted by category, and we'll probably deal with that first in the meeting. And then afterwards, opening up for the participants to send in questions or type in questions that we can answer live. That what we're thinking?
Dan DeVito, is that summarize it?
Yep.
Yeah. I mean, I'm good with that. How is everyone?
Makes sense.
All right.
Yeah, agreed.
Okay, we'll go that way then.
And I think what will work well, because some of the answers to questions may be brief, but then since you as a board have such a keen sense of what people are thinking, feeling, and worried about, you could say, okay, fine, I heard that answer, but could you elaborate some more?
Yeah.
I mean, you really will be the representatives and the voices of your constituents in that way.
Do we want to specify a time limit now for that meeting?
Are you asking us or your
I'm asking
colleagues?
my fellow board members. You want to kind of say 6 to 8? I'd fine. I mean, or let it
6 to 8 is perfect. Yes.
Okay. Yeah. Okay. So 6 to 8 on Tuesday evening. All right. Anything else we need to discuss before we adjourn?
Yeah, Tony, did you actually say a day? I didn't hear if you said a day.
Tuesday.
I'm sorry?
Tuesday.
Tuesday.
Yeah.
I'm suddenly hard of hearing. Okay. Yeah, I think that makes sense.
Unless there's a, unless that's a, you know, unless that doesn't work for the majority of people that need to be,
Yeah,
that participate, you know. So
I think we'll have enough back to you and back to the community that'll be a very productive time. And I don't want to push it later in the week, even a day.
No.
I think the rhythm here for families matters.
So would we take time on that day to deal with the Hurlbut additional sections in the financial review, or are we going to set another meeting to deal with that?
We can do some bit, right? There's nothing to prevent us from doing some business at the beginning of that meeting, right?
I mean, it'll be posted as a special meeting, and how you set that agenda, that's up to you, though. I mean,
Maybe we'll get, yeah, we'll get to that piece of business first, and then we'll do the public forum.
The only thing is financials could take some time. I don't want to shortchange comment. So if we do add it, fine, we can just extend the meeting. I just wanted to say that out loud.
I would echo Ruby's. I think we need to do the financials, but maybe the.
Listen, I'm fine doing another meeting. I mean, but I don't want to overload everyone with meetings. That's all. I'm absolutely fine.
If I would add it, I would add it on the back end, not in the front end.
Oh, that's going to be very painful.
Look, if it makes more sense to schedule a separate meeting to deal with that teacher position, then let's do it so we can keep Tuesday night for the public. But
you know, listen, we can do that on Monday if we're ready with the information. Just find some time on Monday, or, you know, just find some time. Maybe, you know, we can find some time on everyone's calendar to do it. I don't think we need an infinite amount of time, but, you know.
I mean, if you were going to have a meeting prior to Tuesday, I might suggest you have a truncated group from the administration. I mean,
yeah, we
I
don't
think
need.
it's a separate conversation.
Yeah, so do I. I think let's just find another time.
And just to go back to the format of the Q&A, are we gonna somehow group the things that are common themes and address those first, and then open it up to individual ones? So I see some themes of, you know, format of off-campus stuff, right? Or, you know, live stream interactivity means different things in different scenarios, right? I think there's maybe, you know, a half dozen buckets that would answer a lot of questions. How do we organize that?
I think we do that first, and then open it up.
yeah, I think the onus is on the administration to do that. So that's to look at the questions. I already have a sense of the themes, the buckets.
Okay.
Respond within the buckets. Now, I'm glad actually you asked that question, Victor. Those of you who've been through the budget process here for multiple times know we always have this big discussion about, do you want your questions answered in writing or verbally? I'm having a deja vu all over again. I think some of these could be very lean responses, but others it could be, here's the question, and now Lisa Wolak is going to do a brilliant job backed up by, you know, Dan, you know, Doak on here's what it means at that level, or Laura and Patty will, as always, hit the ball out of the park, and it's better for them to do it verbally than me saying, hey, could you spend time writing it? But that, you know, what we can get written, we will, but some of it, I think Tuesday evening could be, they had the question, they give you a quick verbal on it, and then you can probe.
Yeah.
And then follow-up would be, okay, went through all the buckets and themes, but here's more we want to know. Plus, as Dan DeVito's explained, it's a live feed. People could be sending in questions. We need more help on that and more clarification in the meeting.
Yeah, I think the meeting on adding an additional section should be done early in the week. I would love to have that, you know, whatever we do, I would love to have that done before we go in front of the Board of Finance. We're probably going to have to get an update towards the end of the week. Anything else we need to discuss before we adjourn? All right. Well, thanks again for, you know, it's always an incredible journey when we're dealing with this stuff. It just shows the amount of work that went into all of this planning, from the health aspects all the way to how we deliver curriculum. And, you know, while there's a lot more to do and there's a lot of questions, it's just an immense amount of work. And on behalf of the board, I just want to thank everyone for the dedication and the passion that went into all of this. And it goes without saying how much, you know, this is a time when there's no one's going to be 100% happy with whatever we do. It's just one of those situations. But one of the things that I think everyone needs to appreciate is the dedication that goes into making sure that the needs of all of our students are met. And then we're all going to have to work together. We all have a responsibility to make sure this is successful. Our families, our staff, our administration, and the board, we're all in this together. Thank everyone for all of the hard work. Again, there's more to come, but thank you. And with that, can I have a motion to adjourn?
So moved.
So moved.
Okay, all in favor?
Aye.
Meeting adjourned. Good night, everyone.
Thank you.
Good night.
Right.